let's do the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Petra, could you do the roll call? Petra, could you do the roll call, please? Take your time.
All right. Chairman Farrell,
Here.
Mayor Bell,
Here.
Mr. Spencer,
Here.
Mr. Berner, and
Here.
okay. Here. Ms. Tillerson, who's here? And Schubert. Here.
First order of business is the approval of the minutes from our last meeting. Are there any comments on the minutes from last time? Any corrections or edits? Then we'll have the minutes approved. Next order of business, citizen comments on our agenda items. Any comments? Oh, come on, don't be shy. You got a lot of folks in here. You don't. Okay, no comments. Thank you. Next order of business is our old business, which is no old business. And so we'll move on to new business. And the first order is to review and recommend to the town council the approval for the fiscal year 25-26, the charitable grant funding amounts. So do I have a motion?
Well,
Wanna
what
do
is
it
it we
before
would
the
be moving,
presentation?
Mr. Chairman? Are we going to do each one individually, I would assume?
That's what I'm asking for a motion for. I think we should at least discuss them all
Well,
individually.
perhaps an overview first,
Okay.
I would suggest, Mr. Chairman.
Good morning.
Hi, Petra.
These are the 2025 charitable contribution staff recommendations. We had 6 people from the staff. These are the people: Daniel Vincent, Julie Stardomski, Patria St. John, Carolyn Wall, Shantae Graham, and me. This year, we had 19 applicants. Hey, where's my presentation?
It's been a tough morning this morning.
Here we go. This year, we had 19 applicants. The applicants totaled $260,013. We only have $200,000 that we can give to charitable grants. Because we had to cut $60,000 off of it, we took a very close look at each of the applicants, at the guidelines, and each of the recommendations being made by staff was a consensus of the 6 people that came into a group and decided on them. We are recommending $199,024. And next is
Good morning, everyone. I'm Caroline, if we haven't had the pleasure of meeting. I just wanted to begin by saying that I was truly impressed to be able to go out into our community and see the work that was done, and any funding recommendations are truly deserved for these organizations. If you would like to go on to the first slide, Neil. Okay. Amore Healing Kitchen provides whole foods and plant-based meals to those in need and are facing health challenges. They serve over 300 people in Charleston who can enroll themselves or are referred by caregivers, physicians, or family members. They partner with local farmers to provide fresh produce, and they have local high school volunteers assist with cooking and preparing the meals. Once a week, they are able to deliver 4 plant-based nutritious meals, a snack, dessert, and additional resources for healthy eating, and a bouquet of flowers to their clients. They are estimating being able to serve 31 Sea Island clients for 2025,
good.
which is an increase of 10% since last year. They're requesting $7,440, which will be used to cover the cost associated in supporting the Sea Island constituents. This amount covers the cost of 12 weeks of delivery and the raw food cost. We recommend granting the full amount of $7,440. It is admirable that Amore is able to provide thoughtfully prepared, nutritious meals free of charge that promote healing and wellness and are delivered with care to members of our community in need. Backpack Buddies of Seabrook serves over 350 students a year at Mount Zion Elementary, Lambs Elementary, and St. John's High School. They provide weekly food deliveries and dry goods pantry at the high school to ensure students in need are fed over the weekend and can return to school on Monday without the burden of hunger. Their annual budget is about $90,000 for this year, and approximately 59% of the students served are from Johns Island, which makes up the requested $5,000 amount for food purchases for Johns Island students. We recommend funding the full amount requested, as this initiative not only nourishes young minds, but also makes our schools and communities a safe place of understanding, support, and acceptance, providing security and some peace of mind to our families on Johns Island. Barrier Islands Medical Clinic offers a wide range of comprehensive healthcare services, including annual wellness exams, vision care, nutritional support, and free prescription medications to uninsured adults in Charleston. Approximately 65% of their patients receiving free healthcare services live in the 29455 area code. The clinic has the capability to expand their outreach and is requesting $30,000 to support their expanded healthcare initiative, to be used to purchase necessary medical supplies and equipment to continue providing screenings, vaccinations, and high-risk disease management to their existing patient base. We recommend a partial funding amount of $25,000. It is important to note that many of the clinic's patients are dedicated employees of the island's resort community, whose well-being is crucial to the success of this vibrant area. Supporting their health not only helps them, but also strengthens the foundation of our economy and community. Camp High Hopes enrolls 30 children ages 5 through 12 from Title I school zones into an affordable 6-week summer program designed to mitigate the summer slide, which is the lack of attainment of academic skills and knowledge over the summer when school is not in session. Camp High Hopes is able to provide individualized support in mathematics, science, reading, and more to children from Mount Zion, Angel Oak, and Firestone elementary schools. The children also have weekly field trips to cultural institutions and experiences, providing them with opportunities they otherwise may not have access to. They are requesting $10,000 to cover the cost of field trips and transportation to places like the International African American Museum, South Carolina Aquarium, the Children's Museum, and more. We recommend funding of $7,000 according to the amount spent in the provided budget from the previous year's award. In addition to academic growth, the camp fosters vital social development, helping children expand their horizons and build confidence through shared experience and exposure to new environments. Charleston Area Senior Citizens runs our local Meals on Wheels, which currently provides daily meals and wellness checks to their 53 seniors on Johns Island, along with the greater Charleston area. These meals not only ensure that vulnerable seniors have access to healthy food, but also help with their overall well-being and safety, offering a vital lifeline for many. They were requesting $22,369 to cover the total cost of raw food for the Johns Island constituents in 2025. And in fact, the $22,000 is actually half the amount of total cost for raw food for the Johns Island constituents. We recommend granting $15,000 to assist with their operations and help ensure these essential services continue to reach seniors in Johns Island. Charleston Area Therapeutic Writing provides a uniquely tailored learning experience to special education classrooms from local public schools to connect with nature and learn horsemanship that fosters their confidence, physical strength, and social development, among other skills. They are requesting $7,084, and we recommend granting their full request to completely fund the participation of a special education classroom from Johns Island, providing these students with a transformative opportunity that promotes personal growth and community connection. The Kiowa Women's Foundation Backpack Buddies provides food items and snacks for students in need to take home over the weekend. They serve over 350 students from Angel Oak, Minnie Hughes, and Frierson Elementary Schools and Hope Gap Middle School, schools in which the majority of students are living below the poverty line. Their proposed budget is $132,000 for the year, and we recommend funding $12,000 to maintain their operations and continue providing food and nutritional support to children at risk of hunger on Johns and Guatemala Islands. They are able to provide 12 food items weekly and sent home with students on Friday to ensure they are satiated and ready to learn on Monday. Thank you all.
Thank you.
Thank you, Caroline.
Morning, Mr. Chair, members of the Ways and Means Committee. My name's Daniel Vincent. I'm a Planner 1 for the town of Kiowa. This is my colleague, Julie.
Daniel, maybe before you start, just kind of organizational, what we talked about is we're going to go through all of these and listen to what the projections are for them, and then we'll come back with questions and discussion around each one of them, or maybe just straight up approval. So just so you understand the process. Daniel.
Yep. So we'll start with the first charity, Low Country Food Bank. They provide fresh produce, meat, dairy, and shelf-stable items to those in need. In addition to pantry distributions, the program plays a vital role in feeding children by supplying meals during the school day and throughout the summer. The requested funds will be used to purchase nutritious food and fresh produce for distribution at local food pantries on Johns Island and Wadmalaw. Staff recommends $12,000. Our next program is New Webster JIP Food Pantry. Staff recommends $8,000. The New Webster JIP Food Pantry is committed to serving families and for those in need across Johns and Wadmalaw communities. Twice a month, they provide essential food assistance, distributing bags filled with fresh, non-perishable items directly to local families. Currently, they support 123 households, ensuring families have access to food all year round. Beyond distribution, the program also educates recipients on food preparation and promotes financial literacy and safety awareness. The requested funds will be used to purchase perishable and non-perishable food items, ensuring continued support for their bi-monthly distribution events and their mission to combat food insecurities on Johns and Wadmalaw. Next is Operation Home. Staff recommends the $10,000. Many families in poverty struggle to afford critical home repairs, leaving them unsafe and in unhealthy conditions, especially in the harsh coastal weather conditions of South Carolina. As homeowners age or face health challenges, they often lack the financial resources to build ramps for accessibility, repair failing roofs, or address hazardous conditions such as holes in floors, lack of running water, and deteriorating ceilings. For 27 years, Operation Hunger has been dedicated to helping low-income families by providing essential home repairs, including roof replacements, wheelchair ramps, bathroom modifications, heaters, and AC units. These repairs have an immediate and life-changing impact, allowing families to remain in their homes safely. The requested funds will support critical home repairs for up to 50 families in the Johns and Wadmalaw areas, ensuring they have safe, stable, and livable homes.
Our Lady of Mercy Community Outreach. The outreach provides dental, women clinic services, food pantry, clothing closet, home repairs, educational classes such as GED programs, English as a second language, Yes I Can, Child Learning Center, youth financial literacy, and career services. Recommended amount for the charitable contribution that will go directly to the dental program would be $14,000. The Paraclete Foundation of the Holy Spirit Catholic Church is recommend. The Paraclete Foundation Foundation is dedicated to assisting the elderly, disabled, and low-income individuals in need of home repairs on Johns and Waterma Islands. The mission is to improve housing conditions by ensuring the home is safe, healthy, and sanitary. The foundation provides essential home repairs, including replacing collapsed floors, ceilings, damaged windows, repairing cabinets, with renovation of bathrooms to accommodate disabled residents. Grant funding will also be support major projects such as septic systems, replacements, roof repairs, and havoc system restoration to help residents maintain a safe and livable home environment. The requested funds will go directly towards projects planned for repair 2025. Recommended is $12,000. Sea Island Blessing Basket. The Sea Island Blessing Basket is a vital community outreach program dedicated to providing much-needed food assistance to residents of Johns and Waterma Islands living below the federally poverty level. Each month, dedicated volunteers organize and distribute food baskets, ensuring families receive essential nourishment. These baskets contain a rotating selection of fruits, vegetables, meat, eggs, and bread, tailored to meet the community's needs. The program serves approximately 600 residents in Waterma Island and James Island every month. The requested funds will support programs for 2 months, helping sustain the crucial initiative ensuring families continue to receive food assistance they depend on. Recommended $12,000. Thank you.
Good morning. I just want to say it was a privilege to get to meet these charities and these local charities. So our first one is Sea Island Habitat for Humanity. So this is one of the oldest chapters of Habitat for Humanity. It was founded in 1978. So they work to build decent and affordable homes for working families. We are recommending, they're a recurring recipient, so last year they were given $20,000 and the previous year $18,000, so we are recommending $18,000 this year. So this particular grant will help fund the construction of a house for a single mother that is currently a Johns Island resident. The recipient of the homes provide up to 400 hours sweat equity into the homes, and the homes are built with volunteer labor. So St. James Bethel African Methodist Episcopal Church. This is a food pantry program that distributes groceries to individuals on Guatemala and Johns Island. The program has been in existence since 1998. Groceries are distributed every second and fourth Wednesday of the month, and the program supports 110 households annually. So again, a recurring recipient. Previous year in '24, $5,000 was gifted, and the previous year was $3,000. Sweetgrass Garden Co-op. This is a farm, a nonprofit farm that provides free, fresh, naturally grown local produce to charitable food distribution agencies, including for a number of the recipients that we have gone through. Their application, the request is to cover the cost of sowing seeds and fruit and nut trees, which will extend their produce year-round. They currently do provide produce year-round. This just would expand it. A little side that I thought was interesting, they actually have raised planters on the farm that were constructed from old hurricane shelters that came from Kiowa Island after Hurricane Hugo. So I liked that it had a direct connection to Kiowa Island. So I'm going to ask if you would take one and pass one of those. The Feeding the Multitude. So this is a group of partnering churches that provide people in need Thanksgiving, food for Thanksgiving holiday. It serves about 6,600 people annually, and it's, each year it gets larger, and it includes about 100 volunteers from 25 different churches on Johns and Guatemala. The reason I passed that around was in our meeting when we were looking at kind of its status. They, in their application, were sponsored by the Live Oak Church, and then subsequently let us know that they've had to change that to St. John's Parish Church sponsorship. And I just wanted to be clear that that occurred. So they requested 7,000, and we are recommending 4,000. So the Third Serve Foundation requested 13,600, and we are recommending 6,000. This is a new application. The Third Serve Foundation Fit to Serve program promotes healthy living among students on Johns and Guatemala Island by equipping them with tools and resources to adopt and sustain positive lifestyle changes. By integrating tennis with wellness education, Fit to Serve seeks to enhance the physical, mental, and social well-being of underserved youth. So, and they do this both at the Roy Bart Tennis Center as well as the Seabrook Island Tennis Center. So the project is currently divided into two parts, one being monthly wellness workshops tailored for elementary and middle schools, and the other being 2 community workshops. And so our recommendation was to fund the 6 workshops. Their budget kind of broke it down that way. So, and another new applicant, Vision to Learn. This is, the request was $10,000 and we are recommending $8,000. This is a national nonprofit with an Charleston office that started operation in 2021. They provide access to vision screening, eye exams, and new prescription glasses directly to kindergarten through 12th grade students in high need and underserved communities at no cost to the students or the families. So they currently serve a 3-county area, but locally, they also serve our 4 schools here on Johns Island. The clinic is currently scheduled to go to St. John's High School and Edith Frierson Elementary School before the end of this school year. And then next school year, 2025, we'll make a second visit to Hot Gap Middle School and Greg Mathis Charter High School. So the way it broke down, if you look at the services they provide, it comes down to about $130 per free pair of glasses, including the eye exam and the screening. And so if you look at that, the $8,000 would provide about 61 and a half pairs of glasses. So that's our initial.
Patrick. Betrayal. Okay, any questions from the council before we consider a motion?
Shouldn't we have a motion before we get into that?
We can do questions.
Questions to, if you want to move, what are we moving? Are we moving them all? And then if we make any adjustments, there are going to be a lot of amendments, or we're going to move approval each one?
Well, I have comments.
So I have questions and comments.
Yeah.
Let's do comments first, and I think I'd like to go one by one and do them, if that's okay with the
Oh,
council.
no, yeah, moving them in one by one is fine. I have overarching comments.
So maybe we can continue the comments, Mr. Chairman, before we get into
I agree.
comments with regard
Agreed, yeah, agreed. All right, you're looking at me, so I'll go first. So, Mr. Chairman, I have no issues with any one of these, but this is actually more recommendations for the next time we go through this. It wasn't until today that I received any information or any definition of what any of these organizations did. No.
Yes, sir. I made one for everybody. It was laying on your desk.
And, right, so it disappeared somewhere.
Yeah, it's been on your desk for about a week or 10 days.
So it
About a month.
Well, maybe, okay.
Yes.
It disappeared somewhere. All right. I also would like to have a better understanding of how the award amounts were selected. I was looking for rhyme and reason or a pattern. I didn't see any. So I was thinking originally that all the food-related organizations would be getting the 100%, or at least that seemed to be the initial pattern, but that wasn't the case. To be fair and reasonable, I think if we have to limit how much money that we're going to be dispersing, each organization should get 5% less of the request, or whatever it happens to be. Some get 100%, some get less than 50%. What?
So I would take a different approach, just as we're discussing this. It depends on what the organization, for me, it depends on what the organization is doing with the money. So the very crude example, the more money that's spent on food and no administration, the more likely I am to award the full amount. The more administration and salaries and other costs, I'm probably, where a lot of organizations have 100% volunteerism, I'm probably less inclined to award as much money in that way. So it's just a way to think about it rather than just doing pro rata. So I'm thinking more merit-based, what are they doing, and then what are the funds going for, rather than just doing a pro rata. But that's just my thought process.
No, fair enough. So that's,
That's basically what I was going to say.
okay.
It was based on the applicant, what they used the funding for, and what they did with the money that we gave them last year. If you look at some of the applications, those are the things that we looked at. And we didn't base it on taking an even amount off everybody. I don't think that would have been fair to some applicants that are almost 100% volunteer-based.
Well, it just depends on the way you look at it. So if that's going to be the procedure for going forward, I'm okay with that. But I guess we should just codify that if that's the procedure.
Like I said, the six of us sat together. We gave a reason for why we did. Now, we had to cut out $60,000, so we had to have reasons for coming in under what they wanted. But we had to cut $60,000. That was a given.
I understand that. It was just odd, I shouldn't say odd, trying to be fair and equitable rather than,
Sometimes you can't be fair and equitable. Sometimes you have to go by what the application said.
Councilmember Byrne, I might suggest that we can address the issue of why they made a more than 50% reduction in some instances and fully funded some others when we look at each grant application individually, because I think you raise a valid point, whether it's appropriate to do across the board pro rata if you don't, or to take a more idiosyncratic case-by-case approach, but we can certainly address those as we raise.
yeah, I'm
each.
not suggesting to change anything. My comment when I started off is saying, moving forward, the next time we do this.
It might have helped if you'd have gotten the book, and like we all did, so we apologize for you not getting your book.
Thank you.
Other comments or discussion?
Well, it looks like Councilmember Kay is ready to make.
Yeah, thank you. I suspect that the committee spent considerable time on each of these applications and looked hard at what had been done in the past and what was projected to be done in the future. And I like my comfort level with being able to delegate that responsibility out to the committee. So I think that if we have questions about an individual grant, that's fine. Let's raise it on that individual grant. But I think to take an across-the-board approach would be minimizing the work that committee has already done.
Mr. Chairman, a couple of overarching comments. First, I want to commend the hard work of the staff in not only putting together the materials, but the time they spent on site visiting each of the applicants. Impressive range of applicants, and they obviously do important work in the community. I do have kind of a couple of concerns. One is with regard to better understanding the proposals from those organizations which appear to have a very high proportion of their revenues devoted to salaries, expenses, and administration, not program benefits. Better Business Bureau, Charity Navigator, GuideStar, all, I think Better Business Bureau says they're not going to recommend a charity unless at least 65% of program revenues go to program expenses. Charity Navigator, GuideStar at 75% plus. The highest rated charities have generally 90% of revenues go towards program expenses. There are a couple of applicants here where those numbers are almost reversed, where approximately 3/4 of expenses of revenues go towards salaries, administration, fundraising, et cetera, not to program benefits. So unless I can hear some information to suggest why that is the case, I may be hard pressed to personally support those particular applications. No, doesn't really matter how otherwise worthy the work is that is being done. The other thing I just think we need to be careful of as we look at this is some of these applications clearly fit into our guidelines that we've established. Some it's a little bit more of a stretch, and that's certainly our prerogative to do that. But if we're going to stretch very far, then we need to probably either think about revising our guidelines going forward in order to be fair to other organizations that may thought we don't quite meet these guidelines and they did not apply as a result of that.
Thank you. Couple things. As I went through the list, there were 10 organizations that were food-based organizations. 3 were medical, at least this is my categorization. 3 for enrichment and 3 for home. So as I thought about this kind of as a needs-based, that was part of my thinking as well. Number 2 was, Mr. Belt, I thought the same thing you did. I started at the 90% rule. If 90% was going to food or the needed materials, those were more attractive to me, and then worked backwards. And there were a couple that, again, like you said, were in reverse. 3, in my mind, I prioritize food, and then probably shelter, and then probably medical, and then enrichment in that order. For me, the basic needs to survive, you definitely need food, you definitely need shelter. So in my mind, I thought those were the 2 most important, and right behind that was definitely medical. Doesn't mean you don't need enrichment. You certainly need that. That's the kind of dessert, but let's just get through the survival. 4th was, there's a lot of great organizations, 10, providing food. And it seems to me there should be some economies of scale or some competitive advantage, to use a business term, that if the organizations kind of joined forces. And I don't know if you folks have talked about that in the past, but you're all doing great work, and maybe you could do even better work if you kind of coordinated your efforts. There's some overlap. I think there were 2 that worked on kind of the Backpack Buddies part. I don't know if you're together or separate, but just food for thought coming next time. Come together might be a more powerful story for me. And again, you'd get those numbers for delivering food versus your administrative costs. Food up and administrative costs down. Yes, ma'am.
Mr. Bell, I am the president of the Sea Island Hunger Awareness Foundation, and that's exactly what the foundation does.
Awesome.
It brings all the food groups together to work together, to help each other, to not duplicate services.
Well, thank you for doing that. I'm glad to know that that is happening.
It's been going on for 10 years.
That's
It's a 10-year-old program.
That is spectacular, so thank you very much for doing that.
And if I could follow up on that, Mr. Chairman, you did raise one issue, because I noted, for example, that Low Country Food Bank is one of the applicants. But one of the other applicants, the funds that are being requested are to buy foods from the Low Country Food Bank. So I don't quite understand.
What Low Country Food Bank is asking funds for is a program within them.
Yeah, that was a little unclear to me too, yeah. It was, yeah, okay. So kind of with those thoughts in mind, and I'd love to hear anything else from the community. That was a great comment you offered, that you are working together.
I'm having trouble hearing you.
I'm sorry, I'll speak for Mike. I'd love to hear from the community. We raised some discussion items. Is there anything that anybody else would like to share? Kind of like we've shared our kind of thoughts as we go into these requests. Okay. Now, do we want to do these by motion, one by one, or is that acceptable to council?
Mr. Chairman, I move consideration or approval of the Amor Healing Kitchen application funding request, recommendation by staff to fund the applications fully at the $7,440 amount.
Do I hear a second?
Second.
Any discussion?
Indeed. Mr. Chairman, this is one, I made the motion, but I'm going to have trouble supporting this application unless perhaps there's somebody from Amor or that the staff can address the issue of, again, the charity recommendations. This is one where if you look at the budget, $450,000 of program income, $260,000 goes to, actually, $280,000 goes to salary, payroll, and payroll taxes. Another $5,000 for travel and meetings, another $10,000 for fundraising expenses. This is an example of, rather than 75% of revenues going to programs, the opposite is true. About 25% of revenues go to program expenses. About 75% goes to overhead. So notwithstanding what looks like important work that the Amor Healing Kitchen is providing, unless I'm kind of persuaded otherwise as to why that makes sense in this instance, I would have a hard time supporting this particular funding request.
I'm from Amor.
Okay. Yes.
Go up to the podium, state your
Okay.
name.
To speak to our salaries, we have a full-time chef, so he's in the kitchen every day of the week. He creates the menus, he picks up the produce, he works with our donations. So his time is spent working with the teens, training them, having an educational component to what we're doing. So he's not just preparing meals, but he's working with teens to kind of get them engaged in community service. We also pay a culinary manager, and she also is in the kitchen. She has a teenager herself, so she's working with the teens also. So I feel like those two salaries are really more part of our program than they are of administration. So that's their salaries. I'm the program director, so most of my time and my pay goes towards our volunteer. Sorry, I'm very nervous. I don't usually.
Please, we
I
don't
know,
bite. We
and-
don't bite. We may ask tough questions, but we don't bite.
So we have 55 volunteers every week. So we are working to get them in the kitchen. They pick up our donations, they pick up our flowers, they make the bouquets. So a lot of my time is spent just trying to get our volunteers in there and providing and doing the things that support our clients. So I understand, yes, we have a high salary budget. But what you don't see on our budget is that $50,000 worth of produce is donated to us. So we're not spending our money on a lot of produce. We're getting that from local farmers, other nonprofits. So it's a little bit kind of interesting in there. The in-kind donations don't show up because we're not spending money that way. So it's just a little bit of an explanation on that.
The wellness coordinator position?
So that we don't have, that's a future position. So we're not paying anyone for that position right now. That's a future budget position.
Thank you for that explanation, and perhaps this is something going forward we can consider. I know it's not part of a formal set of financials, but the value of donations and in-kind contributions would be very helpful to better understand, because I can certainly understand somebody like, for example, Barrier Island Free Medical Clinic, which is another application. They do have the clinic building, which, and some administrative cost associated with that, which rarely doesn't show up as the real value of the services provided is the time contributed by the doctors and nurses who are not compensated. So I don't know if there's a way kind of going forward we can begin to capture that, or you can show kind of the overall program benefits, quantify the program benefits that are being provided relative to the hard expenses. That would be, I think that would be very helpful.
Sure.
Thank you.
Yep.
Before you go,
Yeah, sorry.
if I read this correctly, this says this is for Charleston County.
So Amore provides food for Charleston County. This is just for Sea Islands. So the amount we're requesting.
Okay, and how do you define Sea Islands?
Johns Island, Wadmalaw Island, those are where we serve clients. We don't serve anyone on Kiowa or Seabrook.
Okay, because as I read through this, Charleston County extends from Edisto to McClellanville.
Right.
So I just want to make sure this was focused.
Right, this is specific to our Johns Island.
Segregate those monies. You do by
So
county,
we
or?
just basically do it by the number of clients we have there. So we look at our overall picture of where we're serving clients, and last year we served 28 people on Johns Island and Wadmalaw Island. We'd like to increase that by 10% this year, which would mean serving 31 clients. And we average 12 weeks of delivery, 4.5 meals each delivery at a price of $4.50 per meal. So that's how we came up with that number.
How do you get your clients, as you define it?
We work with the Sea Islands Blessing Basket. They put our flyer in their bag, maybe quarterly we put it in there. Our Lady of Mercy, we worked with them. They refer clients to us. Word of mouth, doctor's offices. So it comes from different resources.
So do you have more clients now than you can handle?
No,
Not,
no, we
okay.
have the capacity to serve more.
Caroline, any basis for funding at 6,600 relative to the 7,400 and plus requests, because a couple of the others were recommended to be fully funded?
I do recommend full funding for a more healing kitchen, as the grant money, it comprised of the total food cost to serve these Johns Island clients. So I think that is important, and I think it's also important to note that they provided their annual budget, but the grant application is program specific, so.
And my apologies, I see you did recommend full funding, and they were granted a lower amount last year. This would be increased over the prior year. Okay, all right, thank you.
Any other questions on Amore? Shall we vote? All in favor?
Aye.
Aye.
Mr. Chairman, with that explanation provided by the Executive Director of Amore, I will vote aye as well.
Aye. So funding carries unanimously for Amore. All right, Backpack Buddies Sea Island, I think, is next. Do I hear a motion for Backpack Buddies?
So moved.
I have a question.
Has to be
Do I have a second?
first.
Second.
Okay, I have a motion with a first and a second, okay?
And how much does Seabrook contribute to this?
Hi, Mark Snyder with Seabrook Island Backpack Buddies. Our current budget is about $90,000 for the next year. It's fully funded through donations, grants, and fundraising.
And so you're asking for a $5,000 contribution from Kiwa. How
Yes.
much do you get from Seabrook?
Oh, zero. Their charter is different than here. We're going to address that with them again this year. Seabrook Island has specific needs or specific requirements. It's not necessarily feeding the children, it's what does it do for the town of Seabrook.
Okay. They have a charitable grant initiative as well?
They do,
They just have different criteria?
they have different criteria. Yeah. We're going to address that with them again
Okay.
this year. We have asked previous years.
Thank you.
All right, thank you.
This is one where I'm a little confused where the coordination occurs because there are other Backpack Buddy applicants directly and indirectly. And supposedly there is, as I heard, make sure there is no overlap, that there's coordination, but Backpack Buddies of Seabrook Island, even though it doesn't receive any funding from Seabrook Island apparently, says it provides food across Charleston County.
Yes.
So I'm a little confused as how you decide which children participate in the program, your particular organization relative to the other Backpack Buddies.
Okay, so I don't know if there's any members from Kiowa
I'm
Foundation.
Barbara Wilhoft, I'm representing Kiowa Island Backpack Buddies. My understanding, I'm not on the board, I'm just filling in today, but my understanding is that we're separated by the schools we serve. So we serve different schools than the Seabrook. So it's a combination, but we provide different schools with their bags for the weekends.
Our leadership is meeting actually next week with the consolidation of the elementary schools. We're going to meet with them and try and better understand how we can serve the community combined. Currently, we split it by schools. We have traditionally served these 3 schools, 2 of which are on Johns Island. And this funding would particularly go to those students on Johns Island. But we are going to coordinate with the new elementary school with the Kiowa Women's Foundation. Our charters are slightly different. Kiowa Women's Foundation does more than just Backpack Buddies. We are specific to providing food to the schools, or to the children at those schools. So, just blending the two, it's not as easy as just saying, hey, combine it, because we have received donations from people particularly to feed the children, and we do more than just that.
What is the third school that you serve?
We serve Mount Zion, Johns Island High School, and Lambs.
What was the third?
Lambs,
And I'm sorry, where's Lambs?
that's up by the airport. But of the 352 students that we're feeding, 252 are on Johns Island.
And yours is an all-volunteer organization?
All volunteer. 94% of our expenditures go to food.
Any other questions? We have a motion, all in favor?
Aye.
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 Thank you very much.
Approved? Thank you. Barrier Island Free Medical Clinic, I think, is next. Do I have a motion?
Move the approval of the staff's recommendation.
Second.
Discussion.
Well, I would like to, I see that Melissa Frank is in the room, question for her, and then we'll come back, I think, to Caroline as to, in this instance, the staff recommendations for amounts somewhat less than requested. But Melissa, one of the issues is understanding kind of how these dollars are going to be utilized. Our requirement is that we're supporting those in need on Johns Island, Wadmalaw, Barrier Island, which does extraordinary work, and both Councilmember Berner and I had the opportunity to visit with you, and you guys had a chance to come to council and make a presentation. But you've been so successful that you're now also providing services to Dorchester County and Charleston County. So we need to kind of understand, since our mandate, our writ, or at least our guidelines say supporting Johns and Wadmalaw, how you anticipate the requested funds would be utilized, and are they going to be utilized across the three counties, or is this specific to the clinic and service being provided on Johns Island?
Hi, everyone. My name is Melissa Frank, and I'm the Executive Director at Barrier Islands Free Medical Clinic. And I just want to thank you guys for considering our application again this year. So to answer your question, we did expand in September to the entire Tri-County. Currently, 65% of our patients do reside on the Johns Island zip code, and about 4% reside on Wadmalaw Island. So at any given time, we have about 1,000 active patients. So we're looking at over 650 patients currently that reside in the Johns and Wadmalaw area.
So if you recall, I visited the site with Mayor Bell. I was overly impressed with what you guys do.
Thank you.
It's a phenomenal organization. I have to thank you for being there for the residents of the community here.
We appreciate that. Thank you very much.
Yes, Caroline.
So in our efforts to trim off $60,000, Barrier Island was one of the higher requested amounts that we had. And when their expenses were listed out for their proposed use of the funds, they had $5,000 for marketing. And we just, that doesn't fit our criteria, and we needed to cut some funds. So that's how that decision was made there, if that makes sense.
Thank you. You answered one of my questions.
And mine.
Any other discussion? All in favor?
Aye.
Aye.
Barrier Island is funded. Camp High Hopes. Do I have a motion for Camp High Hopes?
So moved. Second.
Discussion? This is one for enrichment. So for me, this is, I don't want to say at the bottom of the list, but the least critical to survival of folks. Their request is not incredibly significant. And I do think that the staff recommendation is taking a look at this and cut it by $3,000 to $7,000, if I'm reading my numbers correctly. I do think enrichment is, I do think we do need some sugar in our lives on occasion, or some sweets. And so I do think this is one of three that we should consider, certainly. And I think that the funds seem to be going in on all the right places. So I was positively inclined to this one.
Mr. Chairman, I clearly support the goals and objectives of the enrichment program. This is one of those that I identified at the outset that I'm struggling to figure out how it fits within our three criteria of health, home, health, and hunger. The program is to increase academic skills by participating and engaging in rigorous curriculum, STEAM program. Again, very laudable and supportable. I don't know if the staff has a perspective on kind of how it fits in our three criteria. And my concern is if we're going to depart from the criteria, and maybe there's a way to look at this expansively, we need to make that clear going forward, because there may be other types of programs or nonprofit organizations, charitable organizations that are not applying because they see the three criteria and say, we don't meet those, yet others are applying that don't clearly as well.
I take your point. I take your point. I think that's right. I would probably not want to exclude this one at this time because our criteria is not expansive enough, but that's for us to vote on. And I do think this one is, of the three enrichment, this is focused more on education rather than sort of activity-based, which again appeals to me even a little bit more, so you're helping prepare students.
Well, if I could say one thing, I agree with you, Mr. Chairman. Education is going to help the person take care of their health and nutrition moving forward. Although it may not be part of the explicit three criteria, perhaps we should be adding it, educational, to get out of, to move yourself up the economic ladder. That's something we should discuss moving forward the next time we go through this. I think educational should be included in the list.
I think we're all in agreement with that, so we can do that moving forward, but I probably still would want to consider this one if it's okay with the council.
Oh, I
We'll have a
certainly
vote,
would.
so-
No, because of what I just said, I certainly would.
Staff?
Something that might make it a little bit easier, when these children are in their summer camp, they are also provided 2 to 3 meals a day. Is that right? Yeah. And so we have representatives here as well if you have any questions for them, but they are able to provide hot, nutritious meals for the students in their care. And, while their parents are working during the summer, it can be difficult to find affordable childcare and especially provide for them as well, so that they have dual purpose there. And then I wanted, it was mentioned earlier, kind of the amount, and I wanted to speak to our partial funding amount. It was determined by looking at their expenses from their previous use of the last grant awarded, and they were able to complete their transportation and field trips with $7,000 and change. So we decided that they might be able to maintain that program with the similar amount they spent last year.
Caroline, one other thing. We've had this discussion in prior council meetings. We can't support a religious proselytization. I do note that the mission statement for Wesley United Methodist Church is to make disciples of Christ by being Christ-centered beacon to all people. Are there any elements of proselytizing that are in the program itself, or did the staff look at that issue?
Right, so the staff did address this, and I think, after I speak on this, I'll allow the representatives to talk about it a little bit more, but that is actually not the camp program's mission statement there. There was a bit of a mix-up in the application. They are simply providing, the church is simply providing the building for them to host the camp out of. Everything else is completely separate, isn't that right? And if you have any questions, I think they could talk about it a little bit more.
Okay. What do the registration fees go toward? A $20 registration fee and a $25 tuition fee per child.
That goes towards helping with field trips and supplies, classroom supplies.
So it's not for salaries for any of the, okay?
This is another one where, again, there may be a basis for, looking at in-kind contributions. I do note that in the revenues, at least in this instance, they do provide a dollar amount for in-kind contributions for the church, facilities and utilities. Notwithstanding that, you'd back that out, revenue is $52,000. And salaries and payroll taxes are more than $32,000. So this is another one where, you have more than 60% of revenue going towards program overhead rather than program itself.
Address that a little bit.
Yeah.
We do hire certified staff from our local public schools to be the teachers and to provide the level of expertise that's needed to help move these children forward. So most of it is for those particular staff members. The rest of us are volunteers. We work with the organization that provides the two youth, I forgot.
The Palmetto Academy.
So the salary expenses go to program personnel,
Right.
of
For the
delivering the
teachers.
program, okay.
Everything else is volunteer.
Thank you for that, I appreciate that.
I have visited that program, and it is an incredible program. I mean, I'm everywhere. And it's about saving these children. It's about putting them in a positive situation. And it's way more than just education. And Patty can address that, because Patty works with children like that, and we're trying to save these children, putting them in a positive place.
Thank you. Thank you.
Right, Patty?
Thank you,
Because
Patty.
if you don't have something for these kids to do, then these kids are gonna become problems in your communities and your neighborhoods. So if they're somewhere learning something and being a part of something, to make them understand that they have a moral responsibility to the community, then you don't have them breaking in your homes, breaking in your businesses and all of that kind of stuff. So this is needed.
Putting the idle hands to work. I understand. Any other discussion? All in favor?
Aye.
Aye.
And I will be an aye as well, Mr. Chairman, certainly based on those very helpful explanations, but also it is another example where I think going forward, we may need to take a fresh look at our criteria, because I think
Yes.
this is extraordinarily worthwhile type of program
Yes,
for
we-
exactly the
we do.
reasons stated.
Who's gonna, before we leave this, we should assign that responsibility. Who wants to take that responsibility up to writing the criteria for?
We can
inclusion?
work on that at staff level, at the administration level on a go-forward basis.
Okay. Charleston area senior citizens. Do I hear a motion?
So moved.
Second.
Discussion?
Caroline, is this still yours? Could you please provide us with an explanation of the cut of, from 22.4 to 15?
That was simply a budgetary consideration due to the,
Done.
just based on the 60,000 we had to cut. That was another one of our higher ones. And I was going to say for our discussion that if there are any leftover funds, I would consider coming back to this organization to increase their approved grant amount is what I would like to recommend. It's a huge operation. Their meal cost to delivery in Johns Island is about $8 a meal. And so I think with the 15,000, we are just trying to allocate as much as possible as we could with the budget there, with no specific considerations made regarding the deduction.
Is this also considered Meals on Wheels?
Yes.
Yep.
I know several people who volunteer for.
Yeah, they have
So
a-
is this funding Meals on Wheels, or is this funding the Charleston Area Senior Citizen Services? Because
The program.
we're not allowed to do pass-through funding.
Right, so Meals on Wheels is the program of Charleston area senior citizens. They're the overarching organization for Meals on Wheels, correct? Correct. Okay. So that's just our local Meals on Wheels program is facilitated by Charleston area senior citizens. Sorry if that was not clear. We also have Donna Cook here, a representative from the organization, if you have any other questions.
I'm sorry, I'm just realizing this now. What demographic, does this feed all of Charleston County, this specific program, or is it dedicated to Wadmalaw, Johns Island, James Island?
The Meals on Wheels program in Charleston does serve Greater Charleston, but Donna provided the breakdown of their clients served over here on the Sea Islands.
Sorry, I missed that.
Good morning. My name's Donna. I'm the Executive Director for Charleston Area Seniors. And it is a little confusing when you look at the grant and you got us as the umbrella, and then Meals on Wheels is one of the programs that we operate under our umbrella. We do serve about 500 to 600 meals a day all across Charleston County, but on the Johns and Wamala area, we're serving between 53. Yeah, between 50 and 60, depending upon those that would come off the waiting list, and then some people come off of the service list, and then we kind of rotate back and forth. But what we're requesting is the raw food costs only for those meals.
For Wadmalaw.
For Wadmalaw and Johns Island, yes.
Thank you.
It ended up being just half of the raw food cost, wasn't it?
Yes, we have the blessing of having partners in this area. Sea Island Hunger is one of them. The Point is another group. So we're very blessed to have great partners in this area. So we were asking for a portion of what the food cost would be.
Just one question. I'm curious, and I guess I'm trying to put pressure on your board members. You show your overall revenues for the organization's board contributions is a total $600. I've been on the boards of nonprofit organizations, and there's usually some direct or indirect pressure on board members to, if they're going to be on the board of a nonprofit, to step up not only with their time and energy, but also financial support. I'm kind of surprised at that low number.
Yes, it is a low number, and it is one of the areas that we struggle. Our board that we have are a lot of pastors and such who don't have access to a ton of cash, but they are willing to dedicate their time. And one of our board members actually works at Kiowa Island as a naturalist, and so he does help us partner with the marathon for food drives and things like that. So a lot of times it's not actual cash, but time and energy and in-kind funds that they'll give us.
And did we fund this previously? Because on your CAC budget from 2024-25, you list all your sources of revenue, but Kiowa was not listed as one of them.
Oh, I'm sorry. That was an error on my part. Yes, we did get funded last year.
Okay. City of Charleston, Berkeley Exchange Club, so on and so forth, but no Kiowa.
I'm sorry.
Okay. All right.
Is the Exchange Club the Kiowa Seabrook Exchange
Yes.
Club?
Mm-hmm.
What is,
Sorry, we gave them just over $12,000 last year, so my $15,000 kind of met in the middle of their request and the previously awarded grant.
and what is CLTC?
Community Long-Term Care Funds. It's one of the grant pots that we work with. Medicare, Medicaid will often pay for Meals on Wheels that way.
Great, thank you. Any other questions or discussion? All in favor?
Aye.
Aye.
Aye. Meals on Wheels is passed. Charleston Area Therapeutic Riding, I believe is next. Do I have a motion?
So move.
Second.
Discussion? This is a fully funded request.
Yeah, this is a surprise to me, so
My recollection is that the council had previously declined to fund this applicant. Is that correct? We have. Okay. I thought there was. I seem to recall that there was a view that we felt it was.
Getting a nod from the back that it was declined.
Like 5 years ago, maybe. We declined it 5 years ago, but we have funded them, I think, last year.
In your spreadsheet, it will tell you,
Yeah.
well, it gives you the last 2 years, but it's been funded very many years, like she said, probably 5 years now.
Okay.
At the same amount.
Does this fall clearly under our criteria, or is this outside of our criteria? Or marginal?
Yeah, I would say special education can be contributed under the health category.
May have been third serve if that was the case. Okay. All right.
Can someone talk about the classroom aspect of this? Is there somebody here?
And also the cost categories, a significant portion of this goes towards staffing. Again, is that administrative staff or is that programmatic staff?
So, hi, I'm Grace Ryan. I'm Cater's Philanthropy Director. It's nice to be here. Thank you for your continued support over the years. Going back to your first question, the classroom question. So all of our instructors are called PATH certified instructors. So PATH is our governing body. That is a professional association of therapeutic riding, and that's an international organization. So our instructors go through a rigorous process and continue to keep up their certifications throughout the year through different educational outreach programs that we offer. So each session, our instructors go to the classrooms of the schools that we're working with that session for the first week to kind of bring the barn to the classroom, kind of showing kind of the curriculum and everything that we're going to work on, and then the students come to the farm the very next week. And then forgive me, what was your second question? Oh, the salaries. So yes, that's all towards our program. So that's for instructors, the use of horses, all of our equipment that we use, everything for the program specifically.
Where do you guys ride?
Where do we ride? So our farm is right off of River Road. You've probably passed it coming back and forth. We're 43 acres right off River Road off Hamilton. And so Cater actually owns the 43 acres.
And how many of the kids are from, you said the geographic area served as Charleston, Dorchester, and Berkeley. And we're really focused on
Yes,
Johns Island.
our public school program is strictly Johns Island and Watamala. So we're currently working with St. John's and Mount Zion right now.
Okay, thank you. So expand on that. How does your geographic area, what does that mean when you say Charleston, Dorchester, and Berkeley? Are there other schools and other programs, or?
Yes, so our public school program is just one of our many programs that we offer at Cater. So we have our individual therapeutic riding program. So that's kind of individualized. Could be an independent lesson, could be a group lesson. That's not affiliated with the school programs, but the public school programs are specifically to the Sea Island areas. And then we have a veterans program. We have connecting with horses for older adults, so dealing with dementia patients and other situations. So we have kind of a lot of different tiers of programming.
This is kind of an ancillary question, but do you have any data that suggests continuing horsemanship so that folks go through your program? What about 5 years later, 10 years later? Do you have any kind of data?
So I wouldn't know, it's not necessarily data, but we've had some experiences where we've had some of our students actually come back and be volunteers in our program, or work with different committees for our fundraisers, especially our veterans program, and even some of our high school students from the public school program come back and volunteer, almost like an aide to an instructor during summer camps.
We also work very closely with teachers from the schools to identify what curriculum they need to focus on while they're at the horse farm. And she can talk a little bit more about that. So at the end of the time, they're able to see what progress has been made on those certain markers that they have identified.
Yes, our instructors work very closely with the teachers at the school throughout the whole curriculum in our programs, based on have a total session goal at the end. Whatever they're working on in the classroom, we kind of bring out to the farm as well.
How long has this program been in existence?
The public school program has been going, so Cater is 34 years, so it's about 30 years old.
Okay, thank you.
So, Mr. Chairman, this is one, and perhaps if you come back with a future application and in future years address this, this is another one where total income of $800,000, and you start looking at the list of expenses, about $450,000 on salary and payroll-related expenses. You've got another 70-some thousand in fundraising cost, another 20,000 in marketing, another one of, bonuses and 401K matches and healthcare, et cetera. A substantial portion of revenue, well over 50%, is going to administrative.
So in light of that, would you like to amend the motion to reduce it from full funding to something because of that?
No, I will accept the staff's recommendation in this instance, but I think on a go-forward basis and part of our criteria, it's an issue that I think we should bake into our criteria is whether we establish some level of cutoff. We didn't do that in this instance, so.
Yeah, if I recall, this was the most egregious in terms of the monies that are not going program-specific.
Although I think that when we think administrative, that could be a broad term. I think of administrative as somebody sitting in an office, as opposed to the way she described the salaries. It's for the writers and the instructors.
I think we need to have a better understanding or breakdown of that. I agree. If it's purely administrative, if it's salaries for certified program, instructors or something like that, that's a different matter.
Yeah.
Any other discussion?
No, thank you.
Where's Petra? Okay. All in favor?
Aye.
Aye. Therapeutic writing passes, fully funded. Kiowa Women's Foundation.
I would like the council to consider the same deliberations they imposed on the Seabrook Island Backpack Buddies onto this organization as well, as they are serving a very similar number of clients with very different budgets, so.
The Backpack Buddies had a very modest ask of $5,000 without a huge contributed fund. And so I think it's important to note that they're able to do that work with that money, and then Kiowa Island has a slightly different story happening with their budget.
So why is that the case? Do we have somebody from yes?
Can we do a motion?
Yeah, I guess I move that we approve the staff's recommendation with regard to the Kiowa Women's Foundation grant application.
Second.
Thank you. Discussion? Yeah,
Oh,
please.
Again, I'm not on the board. I do know that some of our expenses are different. We do have to pay for space to house our food and then where we pack it.
I'm sorry, what kind of space?
We have to pay for our
Pay for
space.
it, okay.
We used to be in donated space, and that's just no longer available to us.
Where is your space?
It's by the ACE, the little business park that's right next door to ACE.
Ace Hardware?
Ace Hardware, yeah. I understand that we get a break on the rent there, but again, I don't have the numbers. If you'd like them, I can have the board treasurer get back to you.
I do note that you are an all-volunteer workforce, no
All
paid staff.
volunteer, our only costs would be the rent and any cost to keep our website going. But everything else is all volunteer. We have about 150 volunteers. We pack the bags, I order the food, we have volunteers that go pick up the food, we have volunteers that deliver the food to the schools. We serve 4 schools, 3 of which are on the Johns Island, Wadmalaw area. These students are identified by the school staff. They all receive breakfast and lunch at school. They're all under the poverty level.
Well, certainly your overall administrative expenses as a proportion of total income are much less than some other applicants, even if they are more than Backpack Buddies of Seabrook Island. So I certainly understand and appreciate that. And that's, I think, why the staff was recommending in this instance, where it was not the recommendation of quite the full funding request, 12,000 instead of 15,000.
So donation processing fees, is that bank fees? Or what is that?
I would assume they are, but again, I'm not the treasurer.
I know what they are. Sorry, I have code my website for our nonprofit.
If you donate with a credit card on most online platforms, there's a processing fee, and most nonprofits choose to eat that fee as opposed to tacking it on to their donor.
Thank you. Any other discussion? All in favor?
Aye.
Aye.
Thank you.
Motion passes for Kiowa Women's Foundation. Low Country Food Bank.
Mr. Chairman, I move we approve the staff's recommendation for an allocation of charitable funds to Low Country Food Bank in the amount of $12,000.
Second.
Discussion.
Well, this is one I would like to understand where the award is supposedly for food purchases, and yet one of the other applicants then has to purchase food from the Low Country Food Bank. I don't quite get how that works. If we're providing funds to purchase food for distribution to the needy at the Low Country Food Bank, why are other nonprofits then having to purchase food from Low Country Food Bank, and how do those economics work?
They have trucks and drivers and directors and all they have to pay. So some of the food they give us free and some of it we pay for to support their organization. I mean, it's a huge business. Their prices are usually very reasonable, and compared to what you have to pay at the grocery store, they're less than what you have to pay at the grocery store for their food.
When the other organizations are purchasing from the Low Country Food Bank, are they purchasing at cost?
I can't hear you.
The question is, are they purchasing at cost from the Low Country Food Bank? Because the application itself says the food purchase is $42,000, so we and others are providing funding support to actually buy the food, and I assume that food would then, I would have thought that food would have been distributed to those in need without any additional cost, but yet some of our other applicants are having to repurchase the food. We're just provided funding support to purchase at the Low Country Food Bank.
Good morning, Mr. Mayor, and to the board. My name is Ryan Brown. I'm the Director of Agency Relations at the Low Country Food Bank. Thank you again for your consideration of this grant this year and in previous years that y'all have supported us. So through this grant, we've gone down two different tracks. One is in the proposal, we propose to do 2 large produce distributions. So that will help us cover the cost of purchasing that produce, and then we'll have that distribution in the summer, and then as we get into the holidays later this year. The other track was for agency support. Now, we would say agencies, think of those as, we have a number that are represented in the room today, support to them. So what we'll essentially do, we'll take the cost of the distributions and the balance that we have left of the remaining funds, we'll then divide that between the agencies that we've mentioned in this proposal. So basically putting that as basically a shopping credit onto their account. So as they're purchasing food from us, as Ms. Salvo just said, there's a cost involved for us to purchase this food and then make that available to our partner agencies. There are some items, for example, fresh produce. We do not charge our partner agencies for any fresh produce because, as the chairman noted earlier, we're trying to use food for health. And so we want to encourage folks to use fresh produce as for its vitamins and all the good stuff that comes along with fresh produce. But there are other things that do have a cost. So everything from a case of peanut butter to a case of beans to a pallet of meat. There are costs involved with that. And so we try to get that price point as best we can to provide that to our partner agencies. We try to be a supplement for them. We know we can't be the sole food source for our partners. Sometimes we'll refer them to, the big box retailers and those types of folks. But we do try to get the price point right so it doesn't blow the budgets of our partner agencies.
Thank you for that explanation.
Yes, sir.
It's an interesting network that I don't have a good understanding of and need to spend some more time learning about it.
So what do you support in Johns Islands and Wadmalaw, and how is that support delivered?
We have Hebron Zion and St. James Bethel AME, and there was New Webster. Sea Island Blessing Basket is in the room. Our Lady of Mercy is also in the room. Those are partner agencies of ours.
And when you say partner agency, do you provide them with food? Do you sell them food? How does that agency relationship work?
Sure. So we get food from a number of different sources. There's food that we purchase from our vendors and local farmers and things, and we make that available to our partner agencies. We also receive food from the Department of Agriculture to operate programs that are federally supported. A number of our partner agencies in the room participate in those programs. That food is at no cost to the agencies. There are some income guidelines that the Department of Agriculture requires that our agencies verify for families that get that food, but that is at no cost to the partners or to their neighbors.
So, and I don't know if there is, so I'm kind of looking at the other applications. There is an application from St. James Bethel AME Church.
Yes, sir.
So theirs is for $3,300 of food purchases from Low Country Food Bank. So
I haven't read their application. I don't know if they're specifically saying that they're going to purchase food from us.
that's what it says.
I'm not familiar with that application, I'm afraid.
Okay, well, this is one of those that I'm trying to understand. So do you know if you are selling food to St. Bethel? Or
Yes, sir, we are.
You are, you're
Yes, sir.
selling, so you're not providing the food gratis?
No, sir, unfortunately, like Ms. Alba mentioned a moment ago, we do have costs that we have to factor into from keeping the lights on, the refrigerators going.
But you do know that's like 18 cents a pound for meat, 10 cents a pound for frozen.
Right, it's definitely not it's not like a retail markup or
Okay.
anything like that, for sure.
Okay,
Yes, sir.
Very minimal.
thank you.
Yes, sir.
In your expenses, what is federal products and grants?
So the federal products would be, for example, some of our partner agencies participate in a program, we call it TFAP or USDA foods. Those are federally supported commodities that the federal government purchases from farmers, that type of thing, and then they distribute those across what we call our Feeding America network, which is 200 regional food banks, including Low Country Food Bank, that provide that food at no cost to their neighbors.
And so what is that? You say it's a product. Is it like rice or what is that? That's
It's a lot of stuff. It can be fish, chicken, produce. A lot of folks remember during the worst of COVID, all the chickpeas that we had that we couldn't get rid of for years and years, and we're still going through all that. So it varies. It really does vary. It's not the same allotment every single time.
And then the grants part of it, what does grants mean? Federal products and grants.
Well, the federal products would be the federal commodities that I was just referring to. And from time to time, there are grants that we get from the Department of Agriculture to support everything from food purchases, technology, those types of things.
This is listed as an expense. If you're getting money from the federal government, you've got it in the wrong place. It should be income. You've got $12 million on your budget listed as an expense. That's about 15% of your budget. So I'm trying to understand, you're saying some of that is food?
I'm not the grant writer. I'd have to check with her about how she had that listed out in there.
You've got it both as an income, federal products and grants, and you got it as an expense. The numbers are different. The income is greater than the expense, but does anybody have any idea what that might be?
Is that your money in, money out? Like, so your grants are funding direct programs, it's kind of almost like you got that money
It's like, it's a pass-through almost?
Yeah, kind of. You can do it as a net, some people mark it as an income and a revenue and an expense.
No, there's several items like that. with-
Yep. Yeah, I don't understand this budget at all.
Yeah, maybe provide some additional clarity around the budget next time.
Oh, yes, ma'am.
Any other discussion?
I would like to share this with the cost of, the increase with the cost of food, in the past 2 years. The grants that the Low Country Food Bank has offered to the different, their different partners have been very, helpful, because what we cannot get from the food bank, because sometimes they don't even have meat. And so we have to go to grocery stores and buy that food, and when you go there, it's very expensive. If they don't have rice, you gotta go to the grocery store and get it. And so because of the things because they offer food to so many different agencies, they run out, and when they run out, the rest of it, we have to go and get. And when you go, I have seen my costs from, shopping at Walmart, 3 years ago, and shopping at Walmart last year. The money it's just such a great increase. You spend, where I was spending $120-something to get grits and rice from Walmart, now I'm spending $420 to get grits and rice. And that's just grits and rice.
So if I may, can you tell me what your sources, is Low Country Food Bank your first call for food? Or is it donations, then Low Country, and then you buy it, or how does that work?
Low Country Food Bank is my first. The donations is second, because donations are not guaranteed. So at least I know I can get food from Low Country Food Bank.
Okay.
And even if it's not what I actually wanted, what I can put in a bag is still gonna give a person, something to eat.
And they are by far my first place to go to.
They do note that they don't share any church paraphernalia at the pantry. So I'm supportive of this application.
If I recall, they serve 123 households. It's about $65 a year for households based on the $8,000 donation. I didn't find anything objectionable here either. I'm supportive of this also.
Yep.
Any other discussion? All in favor?
Aye.
Aye. Operation Home.
Mr. Chairman, I move that we accept the staff's recommendation to provide funding support to Operation Home in the amount of $10,000.
Second.
Discussion? Is someone from Operation Home here? Same question, is this Johns Island and Wadmalaw, or is this Charleston, Dorchester, and Berkeley? What's your area for this donation? What's your area of coverage, please? Good morning.
Good morning. I'm Miriam Langley, the Executive Director of Operation Home. We are so thankful for y'all's many years of support of our families. And yes, our service area is Tri-County. For almost 30 years, we've been helping families remain in their homes. But we designate the funds directly to Johns and Wadmalaw Island families. Like many groups in this room, we have a large service area and a diversity of funders, and we're able to designate thanks to y'all's support. So it stays right here and is used immediately.
I thought it was a very well put together application. I'm curious how you distinguish yourself, compare and contrast from Habitat.
From any habitat?
From the Sea Islands
okay.
Habitat
Great.
for Humanity.
And I don't want to speak on behalf of the Habitat, but they are welcome to. So they're a great partner of ours. So Operation Home, our sole mission is to help families remain in their homes through safety and accessibility. So we do that through the 4 main programs, which are critical home repairs, where we do roof replacements, floor replacements, and bathroom modifications. Wheelchair ramps, where we help families that are literally trapped in their homes get in and out of their homes. And then we distribute heaters and air conditioners to families that have no heat or air. So we do not build from the ground up. We work on owner-occupied homes for families that have lived on their, in their community for generations. And so many of the habitats, I think there's 6, I could be wrong, that 5 to 6 that serve the Tri-County are great referral partners. Some of them do critical home repairs, or they only do some critical home repairs, or they build wheelchair ramps. So some of them also do what we do in a very specific service area, which they are designated to serve.
Well, I commend you on your very well put together application presentation. I appreciated the before and after pictures of the work on the ground.
It just helps tell the story of what y'all's support means and the life-changing impact.
So it looks like the $10,000 grant will take those 9 families on Johns and Wadmalaw that are waiting for these repairs. Will that cover it in addition to the $66,000 that'll fully cover those 9 families?
We will leverage the grant with other funding. Yes, ma'am, I wish that $10,000 could help all of the families, but we'll leverage other dollars to help serve all of the families that we need to. Yes.
Okay.
I hope this is not inappropriate for the whole audience. Do you have any contacts at Johns Island Presbyterian Church?
Do I personally?
Yeah.
My director of community outreach may, but I don't personally, but we may, yes.
I would offer a suggestion to contact Johns Island Presbyterian Church. Elaine Earl is the lady you would contact. They have a budding program that's trying to do exactly the same thing, and they're struggling. They've got funds and they've got resources, but I think one of the issues they come up with is permitting when they do the projects.
Right, yes.
So
It can be a challenge.
I would just suggest give them a call maybe, and there might be a way you can combine forces and leverage the two
Definitely.
organizations.
We have a lot of different partners over here that refer, so I'll certainly mention it to her. Thank you for that.
I hope that's not inappropriate, but.
No. Well, yeah, I think many of us refer back and forth, and we love to help each other for sure. It only helps more families.
Any other discussion? All in favor?
Aye.
Aye. Operation Hope, funded. Home, I keep saying Hope. Our Lady of Mercy. Do I have a motion?
So move.
Second.
Mr. Chairman, I would note that this is an instance where the staff recommended a substantially lower amount than was requested, and perhaps provide some explanation of that. It may relate to the fact that a substantial portion of the request is directed towards salaries rather than direct services. I don't know.
I would like, Daniel, is this you? Please.
So this was a discussion with our group when we were getting together and talking about funds to distribute. A large portion of their $30,000 request was going towards salaries. It is a double-edged sword because it does restrict salaries and operational expenses in our grant requirements, but these go directly towards the doctors that provide the dental care to these people who can't afford it. So these guys who go to the dental care place, they don't pay anything out of pocket, so the doctor has to get paid somehow.
So the dental providers, the doctors, are actually charging for their services rather than donating those services?
Correct. Oh, sorry.
Maybe. Okay.
Would you please come up to the microphone? Thank you.
Is this just for dental? Is this just for dental?
Yes.
Hi, good morning. Thank you for having us today. We have received funding in the past. This year, we switched our funding from our outreach because so many other people are requesting the same type of funding for food and basic emergency needs. We switched it to our dental program. Our dental program, in order to provide the dental program, we have to have an on-staff licensed dentist on staff. That's how we operate under her license. Then we also have, skilled. They're skilled, also skilled, one hygienist we have. And then everything else, we have volunteers. We have volunteer dentists from Roper St. Francis and MUSC, and we also have students from both as well. All of those are on our in-kind line item for services. We've only requested funding for partial of our hygienist's salary. She literally touches almost every patient that walks through the door. And we've only asked for funding for the denture program. That was a new program that we launched last year. And that is to cover the expenses for the resin and all the denture equipment that we need to provide the dentures to the neighbors that we serve.
So that's helpful. I appreciate it. I'm looking at the budget that was approved in total revenue, contribution revenue and grant income and event income, still $2.3 million. Salary, payroll, and benefits exceed $2 million. So there's only $240,000 identified. 10% is going towards at least if you look at your budget, is going to program assistance.
Yes, correct. I am the CFO there, so I am the one that prepares these budgets. We have almost all of our staff, other than administrative, overhead, fundraising, are licensed care providers. We have on-site social workers. We have 4. We have a career services person, that's a 5th, also licensed.
We have 2 teachers, bilingual. We try to be competitive with what they make at the school system. Otherwise, we would not get anybody. And so again, they need to be bilingual. And then we have the dental people. So so those are programmatic people that we would only request funding for if we requested it all in grants. And we've only requested a fraction in this grant for the hygienist.
Well, I'm assuming the 30,000 that you requested doesn't begin to cover the cost of the program.
Oh, that's not even the cost, that's like the salary for the hygienist.
Right.
And you have to be competitive. These dentists and hygienists, they can work in the private sector and make way more money. I mean, you not only are you trying to compete to get the skills to come to us, but then you have to have that mission, they have to have that mission in them, to just want to give up that salary to come and work for a lot less than they can make in the private sector. We were very fortunate in finding our dental director.
Your website doesn't mention this dentistry. I'm glad to hear that you're doing it, but.
It does actually, under our wellness page, it does mention our dental services.
Okay, all right, I'll find
Yeah,
it.
we have it under wellness, and we also offer OBGYN care as well. Yeah. So that is with volunteer doctors. That program is entirely volunteer, provided, and that is in partnership with Roper as well.
So how many patients receive free comprehensive oral care from the program?
On average, we serve about 150 to 200 a month. Last year, we served over 1,500 that received just the cleanings. Now, we also do extractions, fillings, general dentistry care.
And those are all Johns and Wadmalaw?
That's all John's Island members, correct. We do have a small clinic at our downtown location on a Wednesday afternoon, but for 2 hours, only for 2 hours that afternoon, but majority of our services are here on John's Island.
I'm sorry, you did 1,500 last month from?
Last year.
Last year.
Our last fiscal year, it was over 1,500 that we, just cleanings alone.
And so the budget you presented was for the entire outreach services program, not just for the dental program, correct?
The one where you mentioned the 2 million?
Yeah.
Yes, that's the total word budget.
Okay.
All programs, all in.
Okay.
The wellness, the dental is like 300 and some thousand.
357.
Yeah, just John's Island.
Okay.
So do you have any dentists donating their services or all of your dental services?
Yes, from Roper St. Francis and MUSC, they donate.
It's on private practice.
Yes.
We'll donate their time.
So you said you had to have a licensed dentist, and if I get the names wrong, well, you have that on staff.
Staff.
Is that to supervise the program and supervise the dentist? Is that what that's for?
Yes, she does.
As well as the
And
students.
She's mostly there to supervise the students. We get a lot of students that funnel through from both dental schools. So she's there to oversee. So she'll let them do a cleaning, but she's got to go in behind them.
And she does actually provide practice services as well.
Yes, yes, she does.
Yeah, I just was going to bring it up. I'm on your website. It says it's a teaching facility.
Yes. Mhm.
So you're doing more than just
Yeah,
outreach to the community?
Absolutely. Yeah.
I appreciate the explanation. I mean, providing
I mean-
1,500, free cleanings to
And
those.
we own our own building. I mean, so we didn't even touch on like any of the functions to operate the building. I mean, we own it outright, so there's no rent. But keeping up a building that's about 20 years old, you can imagine the expense, big like your house.
As well as the dental equipment.
Exactly, and the operatories and all that, yeah.
Our Lady of Mercy serves a lot of our patients too, so we don't provide dental services or obstetrics, and Our Lady of Mercy sees all of our patients from Johns and Wadmalaw Islands as well.
We partner with quite a few of the organizations in this room.
Honestly, I'm just struggling with the salaries. If you get all this donated dental service, somehow you need to capture that, I think, in the revenue line.
It is, in the total budget, it is in the in-kind contribution line.
Is that where it is?
Yes.
So, Mr. Chairman, I do appreciate if the total program cost associated with the dental program is $300,000 and you're paying one full-time, essentially one licensed dentist, which you're required to do, one licensed hygienist as well, but they would not be able to serve 1,500 provide 1,500 cleans, that as many patients as they cover. So I think the explanation's been very helpful.
How many dentists do you have donating their time?
I believe it's 3 right now. I think it's 3 right now.
And then the dental students are doing just cleanings? Are they doing supervised dental work, or how does that work?
They do both, correct, yes, under the supervision of the licensed dentist that's used the facility.
Okay. Okay. I have no other questions. Anybody? Any further discussion? No. All in favor?
Aye.
Aye.
Thank you.
Thank you. Our Lady of Mercy is approved. Paraclete Foundation of the Holy Spirit Catholic Church.
Chairman, I move approval of the staff recommendation to provide a grant of $12,000 to the Paraclete Foundation.
Second.
Discussion?
Mr. Chairman, again, I found this to be a very thorough and well-prepared application. Again, before and after pictures, I would note that the foundation remarkably incurs no administrative cost or salaries paid. And all the work is being done on Johnson-Wadmalaw Island.
Yeah, I'm looking at the website. They have some very, very impressive before and after photographs and stories of individuals such as disabled firefighters and Army veterans who need this work. So, very worthwhile organization.
This does seem very similar. I don't know if there are distinctions, but very similar to the work that Operation Home does.
And I would note Operation Home, these guys have reached out to Johns Island Presbyterian Church. So there might be more help there for you.
Mr. Carroll, there is a committee, a newly formed committee in all of these organizations that yesterday I was at the meeting are starting to meet together, and they know we can do this, but we can't do this, and so they would give the roof repair to Paraclete. And so they're just to answer your concern, there is so much collaboration now that is going on.
That is awesome. Thank you for sharing that. Any other discussion on Paraclete? All in favor?
Aye.
Paraclete is funded. Sea Island Blessing Basket.
This is another part of the CF family of programs. Serve 600, sorry, do we need a motion?
Yes.
I'm sorry, Mr. Chairman, I move that we recommend to the council approval of the staff's recommendation for Sea Island Blessing Basket, amount of $20,000.
Second.
Discussion?
Materials indicate that they have very low administrative costs, Mr. Chairman. 98% of all donations go directly to feeding those in need.
Any other discussion?
Yeah, Shirley, do you want to elaborate on how this is part of the collaborative effort?
I'm sorry.
Can you elaborate on how this is part of the collaborative effort of food distribution?
Well, there are 12 partners under the Sea Island Hunger Awareness Foundation, and they all provide food or different services related to food on Guatemala and Johns Island. And Reverend Patty is one, and Sandra Middleton's one, and Donna Cook is one, and Amore Healing Kitchen, and Sweetgrass Garden, and any organization, the Backpack Buddies of Seabrook, any organization that needs funding to help with their food program is part of the Sea Island Hunger Awareness Foundation. And then we have 3 programs that we totally fund and run ourselves. And one of them is the Sea Island Blessing Basket. One is a water wellness program, and there's a small one called Crockpot Cooking. So there are 15 organizations under the Sea Island Hunger Awareness Foundation.
And you guys are looking to increase collaboration?
Oh, yeah, absolutely.
All the time?
Yeah, we meet as a group, and with that, we have a meeting this month, and we meet to find out how we can help each other and make the programs better, work together, don't repeat things. It's amazing how we help each other. It really is. If somebody needs something, somebody else has it. It's just wonderful the way we cooperate.
I think that is a wonderful thing. It would be helpful. I'm just trying to figure out how we can be most supportive from the town standpoint in a more efficient way, because we're kind of learning on the go here, and there are several different applicants that are receiving very different funding amounts relative to their requested different amounts and funding at different levels, without a kind of a clear understanding, at least on this one, why it makes sense to fund it at $20,000 level versus a couple of the other applicants at maybe just a $7,000. I just want to make sure we're doing as much as we can, and our modest resources that we're providing the community are leveraged the best possible.
We appreciate that, because it's a real problem feeding the hungry on these islands. There are so many of them. And like Patty said, the food cost just keeps increasing. So thank goodness for the Low Country Food Bank.
I'm just kind of wondering in the future whether something like CIAF submits the application and saying this is how we are intending to allocate amongst our partner organizations to make sure that we get as much coverage in Johns Island and Wadma Island as we can.
I'll be happy to meet with any of you anytime to discuss that.
Would you stay after the meeting and see me if you have time? I would love to.
Well, note, Mr. Chairman, I'm not sure that we've still got a lot of time left in our meeting after this.
I will follow up with you. How about that? I'll follow up with you. Thank you.
And I would like to share this, that the Blessing Basket serves almost 300 people. You know, the rest of us, it's like, you know, from 75 to 100 and something. So their numbers are extremely higher than everybody else's.
Yeah, that's very helpful.
300 each month, right?
Yes.
And the application
And
says,
that's one day. And one day they serve almost 300 people one day, one Saturday, the second Saturday of the month.
the application indicates the funding is for 2 months of purchases.
Another thing we do, you might not know about, is commodity boxes. There are only 2 organizations on Johns Island that take care of the commodity boxes, which are government-provided boxes for seniors at a certain income. And we do almost 200 now, David? Right. And I think Our Lady of Mercy does maybe a little bit more than that. But we provide all the commodity boxes for the seniors on Guatemala and Johns Island.
Thank you. Thank you. Do we have any more discussion on this? All in favor of Sea Island Blessing Basket?
Aye.
Aye.
Sea Island Blessing Basket is funded.
Mr. Chairman, I recommend the committee, I move that the committee recommend to the council approval of the staff's recommendation of $18,000 for Sea Island Habitat for Humanity.
Second.
Any discussion on Sea Island Habitat?
This seems to be for repairs of an individual home.
I think this is for a one-home build.
It is.
Talk to this.
Good morning. I'm John Rood, Executive Director, Sea Island Habitat. I'll tell you about the John Island President in a minute. But the application is for one construction, one new house.
This is for the lumber and roofing, I think, yep.
And I had the good fortune or privilege of being hosted by John recently to do a tour of on-site, yet to be developed new Habitat for Humanity community, where you were going to build how many homes? 30 or
50-ish.
50-ish?
Depending on county, but 50 single-family houses on John's Island.
So off Main Road, kind of across from Berkeley and near the Grayson Oaks farm.
We share things.
Did you get a shovel in his hand, or?
You know, the interesting thing is and I love Miriam Operation Home, as well as Paraclete and Chills. We do repairs as well. So I know that sometimes in years past, we've actually applied for funding for repairs. We do very similar things. Our scope is a little narrower. We do critical repairs just on the outside of John Donne and Guatemala, but owner-occupied repairs. But this application is for construction of the house. We do all play nice in the sandbox. There's so much to do. We could have another dozen groups doing repairs and still have plenty left to do. But,
John. Any other discussion? All in favor?
Aye.
Aye. The Island Habitat is funded. St. James Bethel AMA Church.
Mr. Chairman, I move that the committee recommend to the council the approval of the staff's recommendation of the allocation of grant of $6,000 to St. James Bethel Church for their food purchases from Low Country Food Bank.
Do I hear a second?
Second.
Mr. Chairman, I had basically my questions addressed about
This is
given
all,
the prior
meets all our
conversation.
criteria.
Yep.
Any other discussion? All in favor?
Aye.
St. James is funded. Sweetgrass Garden Co-op.
Mr. Chairman, I move that the committee recommend to the council approval of the staff recommendation of $2,500, the application for Sweetgrass Garden Co-op.
Second.
Discussion?
Is this part of the whole food network?
Yes, we are partners with Sea Island Hunger Awareness Foundation.
And this food is donated, right? It's not sold? Is that correct?
Everything we grow, we donate to emergency food kitchens on Johns Island and Baltimore Islands.
And you're estimating a 50% increase in your current capacity to serve?
Yes.
How is that possible? That's
Yeah.
awesome, by the way.
Yeah, well, so one of the things that we're trying to do is to be more sustainable using permaculture principles and also using, and this, we've not asked for funding for this piece, but to recover our greenhouses so that we're able to continue to grow year-round. We've not had that capacity for the last year because we need funding to go forward. And we're trying to plant new fruit and nut trees so that we can be more sustainable in that way too, instead of having to continue to, in addition to continuing to grow row crops in the ground, we also want to have fruit and nut trees that we don't have to continue to purchase seed for, right? So we've started with mulberries And those grew really well this year on our property, so we want to add fruit and nut trees that are native to South Carolina.
And you are able to sell some tasty honey?
We take donations for tasty honey. Yes, we come under the cottage industry way below the level that you would have to. So. We also have a kitchen. Clemson came to us and wanted to build a community kitchen. A More Healing Kitchen actually started in our kitchen. It's an incubator kitchen so that we can grow economic development projects at Sweetgrass Garden in addition to food, agriculture-based products in our kitchen.
And where is that kitchen?
It's located on the property on Plowground Road.
Okay, I have to ask, what type of pecan trees or what type of nut trees?
So we're looking at a variety of trees that grow well in this area. We already have 7 pecan trees that were planted 50 years ago. So we already are harvesting pecans, but we're looking into other kinds of nuts. Hazelnuts are a big commodity. We'll be giving them away, and more pecan trees. And filberts.
All right, so I want you folks to walk away saying you learned something this meeting today. You know where the hazelnut capital of the world is? It's in Willamette Valley. So if you're a wine drinker and you like Pinot, you go there to visit Pinot wineries, you'll see amazing number of hazelnut trees. I'd never seen one. They grow kind of like a banyan tree, a bunch of small roots. So you learned something today. Hazelnuts in Washington, Oregon State.
Thank you.
You're welcome. Full service meeting here today. Any other discussion? All in favor?
Aye.
Sweetgrass Garden funded. Feeding the multitude.
Mr. Chairman, I move that the committee recommend to the council approval of the staff's recommendation of a grant of $4,000 to Feeding the Multitude.
Second.
Why the cut from $7,000 to $4,000 on this?
That was my only question.
I mean, we're feeding multitudes here, so.
So this is for one occasion on Thanksgiving, and in looking at their budget, they have a carryover of $12,000, and their annual operating costs are $25,000. So we felt like they had a lot of money available to them. When we interviewed each one of these, we mentioned that we may have to make some cuts. Could they still fulfill their mission? And to their credit, every one of them said they would find a way to fulfill their mission. So this was one of those that we felt like we might cut some of that, given the carryover from last year.
So the surplus from last year drove
Yeah.
the decision. Great, thank you. Any other discussion? No. All
I
in
just
favor?
want to note what an important role the bridge players play in some of these initiatives.
Ditto.
No other discussion, all in favor?
Aye.
Aye. Feeding the Multitude is funded. Third Serve Foundation.
Mr. Chairman, I move that the committee recommend to council approval of the staff's recommendation of the Third Serve Foundation application amount of $6,000.
Second?
So, Mr. Chairman, I believe, or Stephanie, correct me if I'm wrong, is this the one we have previously not funded? So this would be, they've applied previously and not funded.
Last 2 years.
Yeah. And I think this was one, again, that the discussion, as I recall, was around whether this really fit our criteria, regardless of how laudable the program is.
Yeah,
This is enrichment, but it's a different kind of enrichment program than the STEAM program or therapeutic writing.
Yeah, I had actually been to one of their events, and it didn't just based on what I saw at the event back in the summer, it did not seem to me to fit our criteria at all. It was, I didn't walk away feeling like they presented that in this application. It was a much different environment and approach, and the kids were from a different socioeconomic bracket.
But Petrea, would you have any thoughts about why the staff in this instance at least recommended some level of funding support well below the request?
So I believe previously, at least the last year, they requested like iPads for the children
That's
to
right.
use going on their thing. And in this case, they put together a wellness program as part of the work, as part of a workshop for when the children are there to help teach health and nutrition. And so we felt like they tried to fit within our guidelines. There is someone here from that organization, if you'd like to hear a little bit more about it. And the way we broke it down was in their budget, they had the workshops spread out across a year, 6 of them. That was the 6,000, and then the 7,600 was for 2 community workshops. So we thought that, you know, as a way to, and this is a new applicant, and to see if it would work, that might be a way to start.
My one concern, I welcome any other thoughts, is the geographic area served as Johns Island, Wadmalaw, Seabrook, and Kiowa. I'm a little bit concerned about serving Seabrook and Kiowa.
I think they use the facility
Okay.
at Seabrook and Kiowa.
Okay.
They use the Roy Bart Center and the
Okay.
tennis facility
Okay.
at Seabrook. Yeah.
Okay.
Can I ask that, speak for us a bit?
Yep. Please.
And for record's sake, this is like the 4th grant I've ever written, and the first one was to y'all last year. So that's why like some of the verbiage is a little off, I think. I'm still learning as I go. But as far as the event I think you're referring to over the summer, probably was our pro exhibition that we had, if I remember correctly, which was a lot more just kind of bringing like the direct community of Kiowa together to kind of talk about what we're doing. But unfortunately, it's hard for us to scoop up all of our students and bring them out to an event like that at the evening time, just because we're working on fundraising right now, as we're a super young organization. We started in 2021. So a big part of us right now is trying to fundraise so that we can expand our programs. But something I think I neglected to leave out in that application, just in how I wrote it, was that a huge part of it, I use the word resources over and over and over. There is what I call, in my terminology, a silent generation of kids right now that don't have parents that are like in their lives at all. So they have no idea about you guys. Like they have no idea that there is access to free medical clinics and food banks and networks like that, because there's a 6-year-old getting his 4-year-old sister out of bed in the morning and walking down the street to E.L. Frierson and going to school only on Tuesdays and Thursdays because they have tennis practice that day. So a huge goal of these workshops and the community events were to be able to bring people like y'all in, as well as paid professionals, of course, too, to run things like biometrics tests. Although I did reach out to Barrier Island and they said they were interested, so that could shift a little bit, but to kind of just educate the community on all the resources that y'all offer. And that's kind of where my head was at when I wrote it.
And so this program is solely for students at Frierson and Outgap?
No, we actually have a Hispanic program in North Charleston, but this project, like this is a project within our program. So our main mission is to teach tennis and supplemental education. This is kind of like a separate thing that would just be for our Frierson and Hot Gap kids.
And so meals are part of this program?
Yes.
So structure, meals, idle hands kind of issues?
Well, also because of those kids that I was talking about whose parents aren't really present, They don't know how to cook, and what they do know how to cook are like Pop-Tarts. So I kind of was thinking as well to do sort of like demonstrations and how-to meals for them to put together, because we do fall under the blanket of the USTA, and the big mission this year is to use tennis as means to advance just health and wellness in individuals. Well, actually it started in 2023 at the US Open, but it's really been implemented this year, and kind of trying to fall within their guidelines is to also use tennis in our respects as a means to advance health and wellness, mentally and physically.
So the students are participating, they pay no cost.
No cost.
How are they selected?
So right now we work through, at Frierson, it's through their enrichment program. So essentially just the after-school kids, the ones whose parents can't pick them up right at 3:30. And then the Hot Gap kids, they are able to sign up at free will. We have transportation services to meet the needs of however many students would like to join.
Can I just speak as a community member who also happened to be an administrator in Frierson years ago? And I can attest to what she said about kids going to school on tennis day because they want to go to the tennis program. And you may not see them for several days, but then if it's tennis day, they come to school because that's how motivated they are.
And so how are they getting from school? Is this after school? It's during school days and after school? So
It's all after school. We put them up on Kiowa Island Golf Resort shuttles. So that is kind of an in-kind donation of ours. We pay for like the gas and the driver and wear and tear, but Kiowa donates their buses to us.
To get people, especially.
How many kids approximately benefit from this or participate in it?
Between Hot Gap and Frierson, well, I guess elementary, we kind of opened up. We have kids from now Angel Oak and Mount Zion as well. But our elementary program generally serves around 50 kids. As we don't make anybody pay, we also don't really take regular roll. The school, there's teachers that come with them through their enrichment program that keeps up with like who's there each day. But we have 50 kids with signed waivers. And then with the Hot Gap program, we have 25 kids with signed waivers, 12 to 13 that regularly attend. But this upcoming year, it won't just be for Hot Gap. It'll be like our elementary program where any middle school student in Charleston can sign up to come out to Seabrook, provided that they have their own transportation. And that's primarily because Frierson is now Montessori. So they'll have middle school students that should be able to participate in our Hot Gap program.
So it looks like it's an 11-week program, but you go full-time for 1 week in September, October, and November, is what I'm reading.
No, so it's a replacement of a tennis practice. So it'll be 6 workshops, 3 a semester, or 3, okay, so there's 6, 3 the first semester, 3 and 3, that's 6, and then 3 and 3 in spring semester, so 12 total. And instead of tennis practice once a month, it'll be switched out entirely with this health and wellness workshop.
I see, okay.
And we do have indoor space to utilize if it's raining, so they won't be on like a tennis court or anything.
Okay, thanks.
And this is at Roy Barth and Seabrook?
Yes, so one is at the Roy Barth Tennis Center and one's at the Seabrook Island Racquet Club.
And what are you going to do with Roy Barth being under construction? Will it all be at Seabrook, or how will that work?
So the project is set to begin in July if the community events would have been approved, but just for the workshops, that's not starting until September. And Roy Barth is projected to be done with construction by June 13th, I think, but I spoke to somebody else who works here that says they know the exact date. You guys might be more familiar than me. But it won't affect our tennis courts, and if for any reason that we need indoor spaces for these workshops, we can take them up to the Sanctuary Hotel. Which I know sounds crazy.
So, Mr. Chairman, my view is that this could be fit under the physical well-being, mental and physical well-being, and health category. Maybe just a bit further afield than, but not much, than the STEAM program, therapeutic riding. I certainly be supportive of giving this a shot. Let's try to monitor, see how this program develops. There's a little bit more to it than I had appreciated, and a fair amount of in-kind contribution from different sources, and we're only funding it at the $6,000 level.
Yeah, I'm in the same camp. I'd like to go visit it and see how it goes this year.
We'd love to have you.
Yeah.
Okay?
Yes, come to real tennis practice and workshop. I think you'd be happy.
Seriously, if you could let us know those dates in
Yes.
advance, that would be helpful.
Yeah.
For sure,
Good.
yes, I
Yeah.
definitely will. Reach out.
Okay.
I'm
And
supportive.
it's Nicole?
Yes.
Okay, thank you.
It's nice to meet you guys. And also, thanks so much for having me today. I've learned so much, not just from y'all, but you guys speaking about your organizations. So as a young one, it's super enlightening to be here.
All right, what's the hazelnut capital of the world?
Excuse me?
What's the hazelnut capital of the world? You learned a lot.
Yeah, something with the Pinot Valley, but you didn't say the exact state that it was
Willamette
in.
Valley, Oregon. There you go. Okay. All right, any other discussion? All in favor?
Aye.
Aye. Third service funded. Vision to Learn, our last one.
Mr. Chairman, I move that the committee recommend to council approval of the staff's recommendation amount of $8,000 to Vision to Learn.
Second.
Discussion? So this falls under medical. It's obviously vision testing and glasses. I have a question about the expenditures.
Mr. Chairman, the only real issue I have is whether it fits our geographic criteria, because what I'm seeing is that the geographic area served is all public schools in Charleston, Dorchester, and Berkeley.
Right.
But they do serve 4 schools, I believe, on Johns Island, including Johns High School, yeah.
I'm Henry Blackford,
And you stayed till the end.
I'm gonna change the name of the program. We're gonna get an A in there somewhere, but I'm Henry Blackford. I'm the volunteer fundraiser for Vision to Learn, and first comment I'd like to make is I am pleased to see that everybody here is all wearing glasses. You all understand the importance of glasses, and but anyway, I'll answer any questions. And we do. We've actually served Mount Zion Elementary the first year, but when they were a Title I school, but they are no longer a Title I school, and by state law, we can only go to Title I schools. When I first started out in 2018, there was a statute in South Carolina that prohibited mobile vision clinics, and we were fought toe-to-toe by the optometrists, and finally they came to the table and we passed a bill and started the program at Sanders Clyde Elementary in 2021, but we do serve all the Title I schools on Johns Island and Wadmalaw, and have been to every school at least once, and are now going back, and between now and the end of the school year, we'll be at St. John High School. And I'll let you know, and would encourage you to come see our optometrist and optician and mobile clinic in operation.
Appreciate your spending 2.5 hours waiting till the bitter end is the last application to be
We're
with
going
us.
to be a vision to next year.
I think that your money's ultimately fungible, but this program is substantially more expansive than just Johns Island and Wadmalaw. I appreciate that you serve Johns Island, Wadmalaw Island's Title I schools, but I don't know if there's an ability to essentially earmark these funds that we approve for the Title I schools on Johns Island and Wadmalaw, because otherwise we're not predominantly funding just Johns Island, Wadmalaw, because I suspect those 5 Title I schools are a relatively small fraction of all the schools served in the Tri-County area.
They are. I mean, I can't argue that. They are a small fraction, but we do serve them. And We've been to all of them once, and now we'll be going back to them a second time. We've actually been to every Charleston School District Title I school once, and now we're going back for a second. And there are an awful lot of children on Johns Island and Wadmalaw who now have glasses that would probably otherwise be without glasses. And, you know, you can't learn if you can't see. And I think it's a tremendous service we provide for the families on Johns Island and Wadmalaw Island that need this kind of service.
So if I do the numbers, if I'm doing this correctly, in part of your application, it says each year 5,000 students receive eye exams and 4,100 pairs of glasses. And then later, and I thank you for doing this, you gave detail about Mount Zion, Hot Gap, St. John's High School. About 1,000 kids received eye screenings. So about 20% of your total eye screenings were done on Johns Island and Wadmalaw. And glasses, it was a much smaller percentage, 280 out of 4,100 pairs.
About 30% of the children that are screened wind up with glasses. There's a few students for whom our optometrist will decide our equipment that we have in the clinic is not adequate because they're suspicious. They see something in the back of their eye and stuff, and so we send them to an ophthalmologist or even to the Storm Eye Institute, and some of those stories are just amazing. But yeah,
I was just commenting kind of to the mayor's point. You know, you service a big area, which is great, but it's beyond our scope of what we're trying to do. And about 20% of your eye screenings are within our scope. I don't know how to think about that yet.
That's why I was trying to get the concept of earmarking, whether there's some way to, when we're counting this.
I guess when we come to St. John High School, you know, someone here could show up with a check, but you know, it's hard for me to then say, okay, I'm gonna give it to this optometrist for this service with this, you know, couple of days. I mean, it's hard to do that, but we do provide the service, and we don't charge. I mean, it's, you know, no charge to the students or their families.
Well, Mr. Mayor, if you do fund it based on a percentage of however we come up with a number of Johns Island students, if you give them that money, then it would still be distributed on a pro rata basis to, you know, just those. It would be all right for
That's
me
what
to
I was
do that.
thinking too.
I don't have a problem with that.
And I want to share a personal story. You've mentioned kids with glasses, and I pay particular close attention to that. At a year old, my daughter was diagnosed with amblyopia with strabismus, and luckily we had access to ophthalmology and eye care. But I noticed more and more kids wearing glasses, and to me that translates it into a kid that probably is potentially not going blind.
I do think it's something we need to think about.
Yeah,
Because we could have
it's one
somebody
of
from the
those
state come in
going
and say-
forward. I'm fully supportive of the program.
It's a
Just
great
how
program.
we've defined our criteria and the use of our funds. But I appreciate it is serving underserved students, in-need students on Johns and Wadmalaw.
And maybe we could establish a threshold, like 20% of the activity has to be on these islands or something like that. Maybe that's a
Or
way to
proportionate
solve the
funds.
problem going forward.
Proportionate funds to their budget or something like that to represent the
Or just a
community or
minimum
something.
amount of service in this service area if your service area is bigger. Because I could see the same thing, somebody coming from the state of South Carolina saying, well, we have folks in Johns Island and Wadmalaw and we need money. So we need to think about that, what we decide on pro rata.
I don't quite understand what you'll be looking for.
I don't either, other than some level of service in this area. That's
Well,
it's a
as an
minimum.
example, if there were an organization like yours that were just focused on Johns Island and Wadmalaw, then it would easily meet our criteria. And I think that's most of the organizations that are presented here today are nonprofits that are either solely focused on Johns Island and Wadmalaw or primarily so. There were a couple we heard also that served the the Tri-County area, Barry Island being one of those. That was a more recent change, but most of their, I think 60% or so more of their patients served are on Johnson, Wabala. So that's just one of our criteria.
I guess I would suggest that if you tried to find a number, I mean, if you took my entire budget of $850,000 and divided it by the number of glasses we'll dispense, it'll come out to about $200 per pair of glasses. But for them, I went and figured out exactly the optometrist time, the optician time, and the cost of glasses. What would that cost? And eliminate all the corporate overhead and that sort of thing, and it comes out to $130 per student. So if you took the number of children on the islands that get glasses and multiply that by $130, it's going to be a lot higher than $8,000.
Yes, sir.
So I don't. I think I'll probably be able to meet almost any criteria you establish, I would guess. But I do appreciate you taking an interest in it.
Absolutely. I mean, for me, I think that the numbers they're producing, 20% and over 1,000 eye screenings. Again, I think we need to follow up with kind of better criteria for broad out-of-state or out-of-region applications. But for this one, and again, $130 for 280 eyeglasses and the screenings, I think I'm okay with this. Any other discussion?
And I will let you know when we're at St. John's High School. I'd love for you to come see the clinic.
Thank you. That would be great.
That would be great. Please do that. Let us know.
Any other discussion? All in favor?
Aye.
Aye.
Thank you very much.
Vision to Learn funded. And I think that completes the charitable applications. Is that correct, Petra? Anything else there? Oh, now we get to do the budget. If you need to fall asleep, now's the time to stay here. Thank you all for coming. Thank you all for your comments and your explanations.
Thank you.
Under tab 3, you should have a budget. Should we take a break?
That would be fine with me, and in part because I don't have my Ways and Means book. I think I have everything.
Let's take a 5-minute break and we'll come back in 5 minutes.
Not actually.
We're making a recommendation to town council.
No.
Oh, it's just discussion.
Yeah, it's just
Okay, so next agenda item in new business is our fiscal year 25-26 budget discussion. Mr. Mayor, you want to speak first and give us kind of the philosophy and approach that you are delivering this budget to us with?
Thank you, Mr. Chairman. So pursuant to state law and our ordinance and the mayor-council form of government, it's the mayor that is obligated to present the budget to council for consideration. We're not actually acting on the budget today. The Ways and Means Committee is not. This is simply a discussion item. But what I want to share is a couple of thoughts and perspectives before I turn it over to Dorota. And first, I want to very much thank Dorota and Stephanie as well for the extraordinary amount of time you've spent with me in going over this line item by line item, then going back over it again, and then going back over it again, and making little, some fairly significant changes and tweaks and adjustments. The one thing I would note from a kind of big picture perspective is that, and I've talked about this in other contexts, we have extraordinarily blessed and from the standpoint of being able to have a diverse set of revenues that significantly exceed our kind of ordinary operating and even non-recurring expenditures. And we've actually suffer from a serious affliction of having more money than we can actually spend in some respects, which has allowed our reserves to build up fairly substantially. Having said that, and as staff will attest, we've taken a pretty hard look at virtually every line item. And just because we have money that we can spend doesn't mean that we will necessarily spend it, at least in a particular year. The overarching philosophy is to ensure that our what I would characterize as we essentially, my way I look at it is two budgets, really an operating budget and then a pass-through accommodations tax-related budget. But we have our recurring revenues, which I think of in terms of the ordinary cost of running the government. And that is primarily staff and administrative related cost, our recurring expenditures that we incur with regard to utilities, maintenance cost, insurance, legal, other professional services, accounting, et cetera. Those types of things that we incur every year, our basic operating budget. And we want to make sure that our revenue streams exceed the operating related expenses, at least to the extent possible. And we've been successful in doing that. We've had some increase, as Councilmember Berner has noted in the past. We certainly had some increase in the cost of government, and the size of government. We've added some staff, but not that many over the last 3 or 4 years. A couple more new staff additions coming on, which we'll talk about. And obviously there are, increased costs associated with those staff, not just the additional staff bodies adding to salary expense and benefits expense, but the cost of living adjustments, salary adjustments, the cost of healthcare insurance going up, all of those things. But overall, it's been, we've been fairly, I think, have had pretty thoughtful approach from the town's perspective overall to cost increases. Where it's gotten a little confusing in the past is we have a lot of non-recurring cost items. And many of those are what I would characterize as really capital expenses that you would generally fund out of a reserve account or a capital account. We've heretofore primarily financed those out of operating revenues because we've had the ability to do so. And we continue to have that ability, and we may want to continue to do some of that, but there are going to be some larger potential cost projects that are going to be beyond the ability of the operating budget to support, but we have substantial reserves. Dorota had to correct me last time when I had the town hall meeting about exactly how all those reserves shake out, but we've got about $43 million in total. 2022 or so is the general fund reserve, so that's wholly unrestricted. There was about $8 or $9 million in the so-called capital reserve that I was mischaracterizing at the time as unrestricted. It's not, and it's not really truly a capital reserve because it's comprised solely of funds from two restricted revenue sources: hospitality taxes and local accommodation taxes. There are a wide range of things that can be spent on, but it's not wholly unrestricted. Then we've set aside funds under our beach Renourishment Fund, and then we also have a couple of other funds we can talk about, and then but all of those funds, the general fund and the capital fund, or any funds that we derive from local accommodations taxes, hospitality tax, local options tax, etc., county accommodations tax. If we don't spend those in any particular year, they continue to grow and accumulate. The one funding source that is not unique to Kiowa, but it's unique to Kiowa in terms of its size of the revenue source relative to our overall budget, is the state accommodations tax. By state law, that has to be spent. All the accommodations tax revenues have to be spent within a 2-year period. So it's always to the extent that we're continuing to generate excess reserves and build up reserves, to the extent we can assign or allocate as many of our expenditures to the state accommodations tax bucket is what we want to do, because ultimately that has to be spent. We don't have much choice in that regard, and we'll talk about some things related to the state accommodations tax. So anyway, that's just a little bit of a background and context. We can certainly go through, this broadly speaking, and this still is a budget that projects revenues in excess of expenditures and continued growth in the reserve accounts. How that overall amount of money is allocated amongst the various accounts, we can have a further conversation about. There are not what I would characterize as many significant kind of operating expense changes. There are a couple, particularly with regard to consultants, but overall, there's not that much change in all kind of the normal recurring revenue and expense-related items. Where we need to have a conversation about going forward are some of these more capital-like projects, and whether we want to, rather than continuing to grow reserves in any given year, including this year, whether we want to start to think about investing some of those monies in projects that we could put off for another day, but we can ask ourselves, if we have the money to do it, why not do so now? But that's just, Mr. Chairman, kind of a high-arching overview of what underpins this, and I'm then now happy to turn it over to our finance director, but if there are any questions about that overarching, approach.
I have a question. Yeah. Where would something like a consulting fee for an engineering project, what budget does that fall into?
Well, I mean, Dorota can discuss that. My view is much like legal, it's just kind of it could be characterized as an operating, regular operating expense, a professional service. And in fact, one of the things we're going to be coming forward to council with, and work with Stephanie on this, is essentially a new on-call engineering services contract, so that we'll procure those services, and after that, just like legal, as needed, when we need some additional engineering expertise, we'll have that just like we have the town attorney. It'll be kind of the town civil engineer. Kika has that on staff, we don't. But then there are going to be significant engineering costs associated with particular large projects. And then I think those engineering costs, whether those will be, those may be separately bid out, I don't know. I would defer to Councilmember Berner, has much more expertise than I, but those may be assigned more to the project. For example, new wing of this building will have to have engineering services associated with that, architectural construction. And so we probably will come up with an overall project budget for that, a component part which might include engineering. There could be some other projects like that if we were to do raising Kiowa Island Parkway at some point in time at the Mingo Point Curve. That would be a substantial project, fairly involved in a lot of cost and would require a fair amount of engineering.
So I'm all for.
Add one thing before. Sure. So at the highest level, Madeline, there's a consulting line in our expenses on the budget there. So think of that as consulting. You can put engineering in either consulting or professional services. And then the second way to think about it is if it's associated with ongoing work, like if we want to do surveying for planning and zoning, that would be in the planning and zoning department as a line item, surveying or engineering or whatever, and be pulled up through here. Or if it was like Kiowa Island Parkway or building a building or something, that surveying would be put in the capital project that's in the summary pages in the back, and that'd be pulled through capital. But we have room to do that. We have some of that we're going to talk about today in the budget already. But if it's ongoing, then it would probably be in our operating budget. If it's a project, it'd be in the project budget. But all be pulled forward to the summary in consulting or engineering or professional services.
And by the way, I should have noted when I noted the amount of time and effort that Dorota and Stephanie have put in this with me. The chair of the Ways and Means Committee has also been involved in this process and invested a fair amount of time in it as well.
So, Mr. Mayor, I just wanted to let you know that the task order contract concept for the engineering is a great way of going forward. Commonly, though, you need to have a minimum amount of work for a task order contract or the hourly rates will be changed. We should look back at historically how much effort a civil engineer would really do annually here. I'm not sure it's that much, unless it's a special project. Idea is good, but we have to be careful what we're entering into because of minimum requirements.
Well, and of course, they may want a minimum requirement. We don't have to agree to any minimum requirement. That'd be part of the process of selecting somebody. Obviously, I believe Kika has Stantec in essentially that role, although they do have more ongoing need.
They do.
Than we have. At least that's been the case heretofore, given some of the things that we may be talking about at the Infrastructure and Public Works Committee meeting, the kickoff meeting tomorrow. Thursday. There is a fairly large list of things that we could potentially utilize some outside consulting expertise.
Oh, absolutely.
Including engineering.
Yeah, absolutely. I just wanted to alert you of minimum requirements, and yes, that's something can be negotiated away, but anyway, so let's not belabor that.
Councilmember Berner, I just want to explain it. So typically what this looks like is actually, it's called an on-call engineer, and you typically have 3, and a lot of jurisdictions have done this, and I've done this in the past. And you essentially will have, it's almost like our.
That's exactly what I'm referring to.
And it's an on-call, and then you can select, depending on the project you select, they may have an hourly rate, and then you kind of move around.
I understand that. Yeah. That's the kind of contracts I used to get involved with. I understand it entirely.
Rhoda, you want to kind of walk us through the narrative highlights?
Sure, yeah, and thank you. So, as the mayor mentioned, we are presenting a draft that will result with about 2.6 million in surplus. And I just want to bring your attention to the page 2, the one that you have on your computers now. So again, what Mayor was talking about, the general fund is our main operating fund. And as you notice, all the funds except for state accommodation tax are projected to have a surplus. And the state accommodation tax has actually a negative only because the money needs to be spent. We've been carrying the money from previous years. So in overall, we are budgeting our revenues at about 17.6 million, which is about 460,000 less than what we're projecting for this year. But there is two big contributors to that, and this is projects, permits from one-time projects. We received a project for the beach walker, and there is a little less in interest revenue projected as the rates have been slowly going down. I don't know if do I need to go to every revenue source, or I just don't know about the time, because if we want to end at 12:30 or not.
Well, I think the main issue that has been raised in the past, Dorota, is, concern about potential for or the actuality of declining revenues over time, or at least some revenue sources will decline over time. So building permit fees is the one that, given that's about 10% of our, not quite 10% of our revenues, not insignificant, that because you won't have as much new construction going forward, that number is likely to continue to come down. It's going to be made up in significant part, but not whole part, by renovation projects, but we don't have as many big new build projects.
Correct. However, this is one of the revenue types that it's up to the council. The fees are up to the council. So even comparing to last year, we collected 1.6 million, but we pretty much projecting about 1.6 million because the council has approved a new fee schedule last year. So even though with that, a year ago, we were actually projecting a big decrease in that revenue source before the fees were changed.
So, Mr. Mayor, if I could, so perhaps the wet rag that you've referenced, you didn't literally say wet rag, but I'm referring to where the trends are going. Just so I'm okay with spending the surplus. I have no problem with anything. It's really more of a cautionary note that I'm trying to put out there. As I go back to the old records, in 2022, our actual revenue is not on this sheet, but our actual revenue in 2022 is $15.5 million. It's now budgeted to be 17.6 moving forward. The math is that's a 14% increase in revenue in just 4 years, okay? My concern is that in the same year of 2022, our salary and benefits, just that one line item alone, in that year, it was 2.3 million. And you can't reference it on anything Dorota has here, but I have the old records. So that salary and expense in 2022 moved from 2.3 million to now almost 3.8. That's a 50% increase versus only a 13% increase in revenue. That's the concern I have. Trends continue, that means we're going negative. And that's the only reason I wanted to bring this up.
No, I do appreciate that. I would say we're a long way from negative, because even if you look at that $1.5 million increase, but we're still this year generating a $2.5 million surplus. We've been
understand.
generating larger surpluses in the past.
I understand, but-
I take your point in that the size of the administrative apparatus has grown somewhat over the last few years. We've added a few bodies.
Right, it's gone up more than the revenue, and that's, again, it's just a trend, it's just
No,
something we need to be aware of.
I'm extraordinarily mindful of the trend, so this year's budget actually only has, I believe, and I'm not sure, I think this is right, only one additional staff person, and there's no assurance that we'll actually hire that staff person. So we've been adding staff, but I mean, my own view is that there is not a near-term need to add staff at the same level we have in the past.
And
or
that's,
in the
and
recent
that's fair.
past.
That's fair. I don't think the budget for this year staffing includes the in-house counsel.
It does not.
Yeah, so that's a big,
And intentionally, it's not included, so essentially my decision at the time was not to put it in the budget, to not take that on this year, for a couple of reasons.
I'm not against it, I'm just saying, trying to get realistic forecasts.
But, and that is a good example of one needs to do the analysis. That could add to your salary and expense line. It would have the potential to actually result in a net decrease in operating expenses.
It could.
Because the whole idea is some of the routine stuff that people are, the outside lawyers are charging us $300 an hour to deal with. You deal with somebody on the staff.
Right.
So, but exactly that type of analysis needs to be done. And yeah, I've kind of done back of the envelope in that, but for various reasons, just because we've got so much ongoing right now. We do have a lot of work in front of our outside counsel. They've been, I would say, more responsive recently on some stuff, not as responsive as I would like them to be, but we're making progress in that regard. Plus, to get on going through the process of hiring somebody and then getting them up to speed. Especially that would be a lot of time, kind of spending time with them.
That would be a lot of you.
I kind of decided this year is not the year.
Yeah, no problem. I'm just trying to be cautionistic, so anyway.
So to echo your comment, Mr. Mayor and I had the exact same conversation Friday morning. I did the same analysis you did Thursday and used different subject matter and came up with a 23% increase in the total budget. Raised that same precautionary tale, and we went through and said, okay, this is a wish list, now let's start cutting, and we did do that exercise to a great extent on Friday. So I've raised the same issue I've had the same realization you're having.
Just out of curiosity, so what are the things that were cut then? You just said you cut stuff, so I'm just curious what they were.
Well, for example, I mean, one area where we ended up making some reductions is on
consulting. In
consulting
consulting
line
for the
item?
planning department.
We went $100,000 or $200,000 out of kind of the projected consulting related fees. But that was a primary one. Most of the other stuff is kind of on a flat expenditure related issues are non-recurring, are fairly flat or modest increases. The challenge we're always going to have, and this is one issue why you want to be careful when you add a head count or apart from head count, even when you're talking about compensation related issues or you're increasing the base, because we've generally had a philosophy of at least paying, cost of living adjustments.
Yes.
And then some salary, merit increases on top of that, or bands change, or you bring in new people that are slightly more have more experience, so you pay them a little bit more. That nut just continues, once you've established the baseline, it starts going up by a
No, I
not
un- I
insignificant
understand.
amount. And healthcare costs, obviously, are a component part of that. Some of the stuff, like whether it's PIBA or the retirement system, that we're kind of at whim and caprice of state law. Insurance costs go up. But if you look kind of line item to line item, other than kind of the salaries, which is largely the salary increase has been primarily, but not solely, a function of adding a couple of new bodies. There hasn't, the recurring budget hasn't changed that much.
Well, I have. I did exactly what you're looking at. I was looking for concerning trends again, and I had not found any other than sanitation or waste management, which we know why that went up. So,
And by that way, on that one, it's mostly, I mean, it's a partly a pass-through. That's, when you look at the revenue sources, there are, as Dorota noted, we can change the building permit fee.
Business license fees.
Business license fee. We can actually increase the local options tax.
No, local accommodation tax.
Accommodation
to
tax
2%.
from, it's just 1% right now. We could go to 2%. We could charge a beach renourishment fee of 1%. It's enabled under state law. We have some levers that we can pull if we need to decrease revenues. We haven't needed to. I would also note that the waste management, while it went up, you pass through a lot of that. Now, we
Yeah, right.
subsidize about $1 million. We could choose to pass through all the cost of trash service. In which case, then you have a immediate $1 million reduction in the expense.
right.
Yeah.
And unfortunately, the IKEA crowd doesn't know that we subsidize it to that tune. But that aside, but I did go through this in a fine-tooth comb, and I did not really find any anomalies that concerned me. So other than waste management, as I said, we know why that just went up. But again, I just wanted to get that out there. I'm all for spending the surplus, but
Now, one uncertainty that I should note is with regard to a significant uncertainty is with regard to the economic relationship with Charleston County. What's baked into the budget is essentially an assumption that our current off-duty contract economics will continue in the future. A couple of things about that. That's not totally within our control. Number two, we should have a conversation either now or at some point about what do we think is the right amount of additional services beyond Charleston County provides this area, because our property taxes pay for them. So we're averaging about $800,000 800 hours a month in off-duty deputy coverage, which works out to $50,000 a month or something, plus or minus, maybe a little bit more than that. And so, we allow right now off-duty deputies to sign up 2 per shift, and 3 different shifts. 8 to 4, 4 to midnight, and midnight to 8 a.m. And we've had very high levels of coverage during the first 2 shifts, much more hit or miss overnight. But occasionally you get, overnight you don't get anybody, and then some nights you get 2 people, and does it make sense to ever have 2? I don't know. That's part of what the assessment is. But that is one, because we're going to be trying to work out a new contract with the sheriff's office, we really don't know what that's
not
going
yet.
to look like.
Not yet.
Now, if it's simply off duty, then it's basically the $55 an hour plus some supervisor. So it might be looking somewhat similar to what it's been in the past, but there are some variables that we've got to work through there.
So, excuse me. So if we were looking at some of the expenditures that come up periodically as part of the community discussion, we look at things like Captain Sam's or purchase of the real estate building at the main gate, where would those kinds of monies come from?
Well, there are a couple of ways. So I've been asked Dorota to start putting together a sense of capital budget. But in the past, we kind of, which was, it caused a lot of confusion. We tried to put a plug number in the annual budget for that big outlier expense. There's no need to do that. If the opportunity came up to acquire the KIRE building, we would have a special call meeting or a regular meeting, and we would say, opportunity to buy this, do we want to do so? How do we want to finance it? We'll pull it out of general, we'll simply do a transfer, an allocation out of general fund, and we'd write a check. I mean, it's literally that easy because we have the wherewithal to do that. With regard to something like the wing, if it's 10, 12, $15 million, we can make a decision at the time how we want to finance that. You could simply write a bunch of checks and continue to draw down the general fund. You could probably, what I would recommend is we issue bonds, we borrow the money, and because all of the cost of the financing are also payable out of accommodations taxes, including state accommodations tax. So you could, we're collecting $3 million, approximately a little over $3 million a year in state accommodations taxes. 25,000, about 175,000 kind of goes into our general fund by state law. It's allocated general fund. The first 30% goes essentially by state law to a marketing or third-party marketing organization. That's been CVB, Charleston's Visitor Bureau, Explore Charleston, 900,000 or so, and we've had about $2.1 million that's still left over. That year, that $2 million that we've received in that year has to be spent within that next year or the next year.
Or it is lost?
Well,
Well, we can carry.
There's another.
Yeah, we kind
there
of
is a mechanism for carrying over some of, for some limited purposes. But generally, that we've been struggling to figure out how to spend that. That's why the goal is, it is the list.
Spend the appropriate monies where we can.
Yeah, wherever you can, where you have an expenditure that can fit within the list of essentially specifically approved expenditures under the state accommodation tax. That's all pursuant to state statute, as well as kind of there's a couple of general conceptual areas. Then it's in our interest to do that. The list of permitted expenditures are similar, but not the same for local accommodations tax and hospitality tax and the Charleston County accommodations tax. They're similar, but they're not the same, but they don't have the requirement that they be spent within the 2-year period.
And so I looked at the rules, engineering fees for capital projects such as we're talking about can be paid for through these accommodation taxes.
At least as far as I read the state accommodations tax, all the cost associated with construction, operation and maintenance, as well as roads coming into, utilities, as well as the financing cost of a civic building, cultural or civic center, can be wholly allocated to the accommodations tax. So
the whole thing's for free.
Well, this is one of these things we're going to have a separate conversation with a kind of a refresh with the state tax committee on a go-forward basis. But I've used this simple example. IOP, Isle of Palms, generates almost very similar amounts of accommodations tax that we do. They make about the same contribution to CVB. They only distribute out, provide for allocation of $50,000 or $75,000 to outside organizations. They use all the accommodations tax them for municipal purposes, and primarily, but not exclusively, beach renourishment, because they don't have a accreting beach like we do. So, you know, if we had a big storm and, you know, a huge storm, and all of a sudden there was a $5 million, you know, needed cost of a beach project, I mean, I would recommend we take the entire $2 million out of state accommodation tax, apply it to that, and another $1 million from the other accommodations tax or hospitality tax funds. And that's how you would deal with that. You'd never touch the general funds, because that's a specifically permitted expenditure.
Yeah, it is. Yeah, I saw that. I was happy to see that.
So we're going to talk more about this to town council meeting, but to this point, Dorada and everybody has done a fabulous job in spending money where we can from the hospitality tax. But there are places where we can allocate more money to the hospitality tax and out of our operating budget. It's in the guidelines. We've just been very conservative in the past. So we've set about a project of looking at this stuff for the accommodations taxes overall and where we can do it. And we're going to continue to look at where we can be not aggressive, just realistic with what everybody else is doing, and spend the money the same way everybody else is doing.
Right, so we're going.
Been incredibly conservative.
You mean
To Dorada's
benchmark communities when you say?
Isle of Palms, Folly Beach,
Hilton Head, Myrtle
Edisto,
Beach.
Hilton, all of them. I've looked at like 5 or 6 in the past 2 weeks.
And
they're
then-
they're more liberal in their use of funds than we are. We've been
And
incredibly
liberal,
conservative.
I'm sorry, liberal meaning they use it themselves?
They use it for every enumerated item that the state allows you to use it for.
Okay, so.
We're not using every enumerated item, and we're not maximizing our expenditures out of.
We are struggling both internally and to external organizations to expend all of the state accommodations tax revenues. We don't get applications actually for the full amount, and there are some instances in which the town should be just saying, we're going to allocate a portion of the revenues for certain projects, and that will be coming up. And I'm mindful, we can certainly go spend as much time on this as we want. I don't know if people want to get lunch. I do want to note that, again,
I do want to get on.
the current, we're still with the projected revenues and expenditures, we're still generating a $2.5 million surplus.
Correct.
But with that surplus, just note a couple of things. One, the consultant costs we're projecting are larger than would be the case on a recurring basis. We've got $200,000 in here for an MUSC pledge. This is the last year of the MUSC pledge. That goes around. We have plugs in here for $200,000-$300,000 line items that ultimately may or may not be spent this year. Building and infrastructure and landscape. So what's in those two things combined is some kind of initial cost that may be assigned to, the building wing, some if we have to do some permitting work or something like that. A potential converting one of the bays in the garage to offices for like public works, because we may need to create some office space in here. What else? There was another building. I can't remember. There was one other kind of potential building-related issue. We may do something if we need to create additional office space. That area where Jan Fox is sitting, which has been the old people where contractors come in, is kind of underutilized. You could do something more with that. So that's kind of a plug number for a lot of expenses related to the campus. Infrastructure and landscape includes.
250 for patching work on Beachwalker Park.
Patching work on Beachwalker. We may conclude, probably it's not going to be nearly that much just to do patching work, and we may conclude, again, this is one of the issues, if we have to spend state tax funds, just go ahead and repave it now, because we have to send the state tax funds and all the funds, 100%, could come out of SATAX.
Right, I understand that. Yeah.
So that's the kind of thing. So right now, it's just a plug number 250 and some other kind of potential
Enhancements
projects out
there.
here about starting some leisure trail sidewalks here, connectivity.
Well, we talked about, yeah, for connectivity, I was going to say the passenger walkway over.
Yes,
Right there.
and or the, what I just had discussed with you guys with regard to kind of the beach, the Betsy Carson Parkway Safety Enhancement and Beautification Project, Keeping Betsy
Right,
Beautiful,
right.
which is kind of a plug number of $50,000. Again, whether that can all be made to happen, I don't know. But the point is, we have a $2.5 million surplus shown where it's not clear that, about, a few $100,000 of that will necessarily be spent, depends on what happens. It could be an opportunity to spend more.
I understand exactly what you're saying. So there's kind of like contingency in that number, so not to worry. I got it.
And I encourage you to look at that 5-year capital plan. That's where the list of projects, we started the list of those extra projects that we want to do through the years. And it was just a handout that I gave you before the meeting.
And Infrastructure and Public Works will start taking another look at some of those issues in more detail. Another one, for example, that we should at least assess is about a decade ago. As you may know, the town of Seabrook Island owns Seabrook Island Utility. The town does. We do not. Municipalities typically own, not always, utilities. About a decade ago, the town went through the kind of the economic analysis. There were discussions about purchasing Kiowa Island Utility. That was not done, but it's another one of those issues that we should probably take a fresh look at for a variety of reasons.
Mm-hmm. Yeah, I agree. Makes sense.
So a long way of saying, the budget has gone up. There's some plug numbers that are driving it up, and there's a lot of, and still we're generating a huge surplus.
Yeah, I understand. And those plug numbers may or may not be expended, and going forward, meaning next fiscal year, they won't be there. So,
And they won't be recurring governmental costs, they'll come out of
so
tax money.
So we're okay.
And I have a detail in that write-up that I just gave you this morning. This is just a first presentation of a draft. So if you have any questions in meantime, after reading that write-up, I'll be happy to answer. And
Great,
the
thank
mayor.
you.
So,
And Madeline's hungry.
yeah, I see that.
We can continue this,
I mean,
if there are no further questions, Dorota, now, if everybody's kind of comfortable. Again, this is just, no action being taken at this time, and it's a living document, and there will continue to be some tweaks as we get some additional information. By the way, I should just mention, what's not reflected in here, although it can be placed under the kind of what monies we had set aside for conservation-related initiatives under the Wildlife and Environmental Services Department. I think, maybe, I'm not sure I'd have forwarded this to you guys yet, but we had received a proposal from the Conservancy with regard to the substantially expanded living shoreline project around the Kiowa Island Bridge. It is my view, now, they were kind of just coming to us and to fund it out of our budget. It's my view, because that deals with preventing erosion, that is fully falls within accommodations taxes. And I'm encouraging them to submit a accommodations tax request for that project.
Great idea.
I was going to talk about that, but in the, in everybody's hunger, I think I'm going to say let's adjourn.
Okay.
We can talk about it later.
Well, we can close it. I don't think there's anything else on the agenda. You go through your citizens' comments, Mr. Chairman, and
But Stephanie, did you have something you wanted to, okay.
There is really nothing, our revenues are within the budget. We have some, as I reported earlier, probably business licenses, building permits are going to be over budget, and expenditures are in line with what we budgeted. So there is really nothing special to report.
That's another thing to note. Dorota is generally fairly conservatively projected revenues as well.
I've noticed that in my time here,
Yes, however, under influence of the mayor. So this year, but we still, conservative, however, I feel like the healthy conservative.
And in part because her direction essentially was from prior councils to be really conservative and to continue to build up reserves for the rainy day. And I get that, I applaud that, but at some point in time, you got to send, what is the money there for? We have a balance sheet unlike any municipality in the state of South Carolina, certainly. What's that? Without a property tax, so.
Okay, let's adjourn.
Okay. Without objection,
Okay.
Mr. Chairman?
So I have no report. We've done the treasurer's report. Citizen comments? Council member comments? Meeting adjourned.